හරි ළමයි අපි පටන් ගමු එහෙනම්. කට්ටිය ජොයින් වෙනකන් උත් එක්ක චූට්ටක් විනාඩි 5ක් විතර යනවා ස්ලොට් එකේ චූට්ටක් ටයිම් එක ගියාම ඉපතේ කමන්නේ මම පොඩ්ඩක් වැඩිපුරත් එක ටයිම් එක තියලා තියෙන්නේ. ඔයාලට ප්‍රැක්ටිස් ක්වෙස්චන්ස් තමයි මෙතන කතා කරන්නේ. මම මිනිත් ක්‍රයිටීරියාස් වලට මාකින් දානවා ළමයි. ගොඩක් වෙලාට මාකින් කියන්නේ සාමාන්‍ය මේ වගේ ප්ලැට්ෆෝම් එකක ඔයා කරන දේවල් අනුව මයිනස් යයි ඉවැලුවේෂන් එක ඔයාගේ මොනවා හරි wrong හෝ unclear responses තිබුණොත් ඒ අනුව මයිනස් දානවා. ඒ වගේම responses වලට not responding හෝ ටිකක් late responses වගේ තියෙනවා නම් add කරනවා. prescription errors, drug interactions, polypharmacy වගේ ඔයා identify කරන්නේ නැත්තම් prescription based ඒවා අහනවා කොට questions ඒවට යනවා. ඊට පස්සේ ගොඩක් වෙලාවට patient advices instructions දෙද්දි confidence නැතිව misleading ඒවා wrong ඒවා තියෙනවා නම් මයිනස් යනවා. ගොඩක් වෙලාවට අර professional behavior එක වගේ speak pattern එක communication skill බලනවා. confidence එක අඩුයි හෝ over confidence බලනවා subject related matters වල. ඒ වගේම prescription book එක සහ record book එක related අහන questions තිබ්බොත් ඒකට යනවා. අපි initial phase එකේ ගොඩක් වෙලාවට මේ prescription book record book focus වෙන එක නැහැ. ඊට වඩා දේවල් අහන්න තියෙන නිසා. එතකොට ඔය වගේ ක්‍රයිටීරියා ටිකක් එක්ක තමයි ඉනිෂියල් phase එකේ අපි questions අහගෙන යන්නේ. ඉස්සරහට තව බලමු අපි. එතකොට ගොඩක් වෙලාවට ඔයගොල්ලෝ මේක එක්ක ටික අර ෆැමිලි වෙනකොට වැඩේ හරියයි. හරි. එතකොට අපි හතක් තුනක් මුලින්ම ඉන්න පුතා පටන් ගමු. ඉන්ඩෙක්ස් නම්බර් 241. අත් පටන් ගමුද පුතේ?
Good evening, sir.
Good evening. Then we are going to start with you, okay? Your time will start now. You can choose one prescription from this slide, Puta. First one as per your choice. Second one will be mine.
I will go with prescription number 4, sir.
Okay. What do you think about this prescription, Puta?
I cannot issue this prescription.
Why?
The prescriber's registration number is not included in this prescription. And also atorvastatin tablet strength is high.
Any other deficiency with that?
And also, sir, enalapril usually given in 10 to 20 milligram daily or BD. In here, 25 milligram is prescribed.
Okay then. Okay. What are the common dosage for the atorvastatin, Puta, as you know?
According to my knowledge, atorvastatin is prescribed from 5 milligram up to 40 milligrams.
Okay. What are the common strengths for the atorvastatin that available in your pharmacy?
10 milligram and 20 milligram.
What is the most fast moving strength?
10 milligrams.
What is the drug category for the atorvastatin?
You mean drug group, sir?
Yes.
It is a lipid lowering drug which belongs to statin group.
Statins. That's when we call it statin, it's like a pet name or like a short name. So what is the exact name for the drug class?
HMG enzyme reductase inhibitor.
What are the other drugs belonging to this same group?
Rosuvastatin and simvastatin. That's all I can remember now, sir.
What are the common side effects that we are expecting with the atorvastatin?
As I remember, atorvastatin can cause liver toxicity,
Mm-hmm.
muscle toxicity, tiredness,
Mm-hmm.
like side effects.
Mm-hmm. What are the common indications for these particular drugs at West?
Atorvastatin is given for hyperlipidemia,
Mm-hmm.
dyslipidemia, and prevention of cardiovascular diseases.
Mm-hmm. Okay. How do you advise for a patient when dispensing atorvastatin like drug?
Take atorvastatin exactly as prescribed dose, frequency, and for the duration.
Mm-hmm.
Do not double the dose if you missed one. Mm, prefer to take atorvastatin at evening.
Mm-hmm.
Check your blood cholesterol level regularly. Maintain a balanced diet and healthy lifestyle, including exercises. Mm,
Mm-hmm. Okay, Putta. Tell me what is the third drug here?
it's enalapril tablets.
Mm-hmm. What is the pharmacological classification and also the therapeutic classification?
Enalapril is an angiotensin converting enzyme inhibitor.
Mm-hmm. Is it therapeutic
And
for the pharmacological classifications?
its pharmacological classification, sir.
Mm-hmm.
And therapeutic classification is uh, antihypertensive.
Mm-hmm. Okay. What are the other AC inhibitors that do you know, Putta?
Ramipril, lisinopril,
Mm-hmm.
that's all I can remember now, sir.
What are the common strengths that available in the market for the NRP?
Uh, most common 10 milligram, sir.
Mm-hmm. Are you sure?
As I can remember, sir.
Mm-hmm. What about the 5 milligram? Mm-hmm. Okay, but what are the common indications for NRP like drugs?
Angiotensin converting enzyme inhibitors are given for hypertension,
Mm-hmm.
heart failure,
Mm-hmm.
and also for diabetic nephropathy.
Mm-hmm. What are the common side effects that we are expecting?
Mm. Enalapril can cause persistent dry cough.
Mm-hmm.
And first dose hypertension, um, and postural hypertension, angioedema.
Mm-hmm. What is first dose hypertension and what is second one?
Pos-
When we say postural hypertension?
First dose hypertension is lowering blood pressure when you take the medicine in first time.
Mm-hmm.
And postural hypertension is lowering blood pressure when you change the position, like when you are sitting and when you stand up, suddenly lowering the blood pressure after taking the tablet.
Mm-hmm. What are the common drugs that you know one to cause first dose hypertension and also the postural hypertension?
Mm. first dose hypertension caused by the AC inhibitors and also ARBs
Mm-hmm.
and also nitrates. Mm,
Mm-hmm.
Postural hypertension can cause by also AC inhibitors and ARBs and also by antipsychotics.
Mm-hmm. Okay, Pata, I was asking a lot of questions from one prescription, so then I am not going for another one, Pata. I am moving with the device. Okay, what is this device, Pata?
It's
Under image number 5.
it's a scalp brain set or butterfly cannula.
Is it available in your pharmacy?
Yes, it is available.
What are the uses or the indications for this particular device?
Um, Scalp brain set is used when peripheral venous access is cannot taken
Mm-hmm.
or give medications intravenously and draw blood samples
Mm-hmm.
and also give fluids.
Mm-hmm. Okay, Mata, tell me generally what kind of dosage form are available in your farms?
Dosage forms we have tablets, capsules, suspensions, creams, and ointments.
Mhm. Okay, but how do you arrange or the store those dosage form in your farms?
Mm. Basically, we arrange medicines in our pharmacy as system wise,
Mm-hmm.
and also we separate the internal and external medicines for liquids.
Mm-hmm.
All the internal liquids are stored in one rack, and also they are categorized according to the system wise.
Mm-hmm.
And refrigerated items are stored in refrigerator,
Mm-hmm.
uh, and formulas and sanitary items are away from medicines.
Mm-hmm.
Uh, and light sensitive medicines we store away from light
Mm-hmm.
in original packs.
Mm-hmm. Okay, what kind of light sensitive products currently available in your farms?
We have thyroxine tablets
Mm-hmm.
and povidone iodine
Mm-hmm.
and capsule type medicines such as doxycycline, omeprazole. Mm,
Mm-hmm. Okay, why we are keeping away from the light? Why it is essential for the pharmaceutical?
to protect the active ingredients
Mm-hmm.
in the products.
Okay, what's happened when pharmaceutical are exposed to light?
They may be changed into another structural molecule or degrade.
Mhm. Okay, Pata. How do you manage inventory in your pharmacy? Tell me about inventory control in your pharmacy.
We always list out the medications in our pharmacy in a book, and the expiry dates and the amounts with the mm, name of the medications.
Mm-hmm.
Mm, the supplier details are also mentioned in the book. Mm, and check the expiry dates regularly, like once weekly.
Mhm. Tell me about the inventory management more, Pata. How do you make a purchase or make a order for your farms?
We track the medicines according to the demand, and when the stock goes lower, we order the medicines by the regular suppliers. And after uh, upon the receiving the medications, we check the medicines before taking into the inventory.
Okay, Pata. What is this product on the image number 3?
It's hydrocortisone ointment, 1% according to the USP, sir.
Is hydrocortisone ointments are available in our farms?
Yes, sir, available.
How do you advise for a patient when dispensing a dosage and dosage form like ointment?
Ointments.
How do you advise for a patient regarding apply and use?
This dosage form should be applied on affected areas according to the instructions by the prescriber. And ointments should not apply on dry skin.
Okay, Pata, your time almost over, Pata. I will publish the marks together for the overall. පුතාගේ ඉන්වෙන්ටරි මැනේජ්මන්ට් ආයෙ චුට්ටක් බලා ගන්න. එතන හිර වුණා ටික. patient advices කියද්දි සමහර තැන්වල චුට්ටක් තියෙනවා හිර වෙන ගතියක්. patient advices චුට්ට ආයෙ බලන්න drugs සහ dosage form wise. ඒ අරින්න ලොකු issue එකක් නෑ අර confidence level එකේ ටික. ඕකේ ලොකුවට වෙයිට් කරන්න ආන්සර් කරනවා. අර ටික චුට්ට ආයෙ බලන්න පුතේ සමහර මට හිතෙනවා ඉන්වෙන්ටරි මැනේජ්මන්ට් එහෙම ටච් වෙලා නෑ වගේ එකක් තියෙනවා. චුට්ටක් බලන්න.
Okay, sir, thank you.
හරි ඊළඟට ළමයි පස්සේ දාලා තිබුණා පුතෙක් ඊළඟ ස්ලොට් එකට ඉන්නවද? ඉන්ඩෙක්ස් නම්බර් එක මට මතක නෑ. ඕගොල්ලෝ ස්ලොට් එක ගන්නවා නම් ගන්න ළමයි නැත්නම් අපරාධයක් වෙන්නේ. ඉන්නවද ළමයි? 586. හරි. ඒ වෙනුවට වෙන කවුරු හරි ඉන්නවද perform කරන්න කැමති? වෙලාව යවන්න නැතුව ටක් ගාලා ගන්න ළමයි. වෙන කවුරු හරි ඉන්නවද ළමයි? දැන් වැඩේ ස්ලොට් දීපුවාම ඊළඟට වැඩේ ඉස්සරහා ඉන්න අය ගන්නත් බෑ. එහෙම වුණොත් ඒ ළමයින්ට අසාධාරණනේ. ඒගොල්ලෝ ඒ ස්ලොට් එක වෙලාවට ලෑස්තිලානේ. ඒකයි. හරි පුතේ හරි. හරි. එතකොට පුතාගේ ඉන්ඩෙක්ස් නම්බර් එක පුතේ
1709.
1709 නේ. Okay. Shall we start Pata?
Okay, sir.
Okay, Pata. Okay, what is your name and where are you from, Pata?
I am Iris, sir. I am from Chilao.
What is your pharmacy, Pata?
Chilao Healthcare Pharmacy.
Who is your master pharmacist?
My master pharmacist name is Mr. Aruna Kumar.
Okay, you can choose one prescription from this slide, but prescription number 4 already taken.
Okay, sir. Prescription number 3.
Okay. What do you think about prescription number 3?
It has a not major side effect of interaction.
Mm-hmm.
Intermediate interaction have
Mm-hmm.
and yes, sir.
What do you think about the date of the prescription? Can you
It's
dispense?
a can't say dispense out of date.
Yes, it is out of date prescription. Okay. What about the prescribed drugs and durations of the treatment?
This drug prescribed as 3 days.
Mm-hmm. Are you satisfied with the drugs and the durations?
Budesonide MDI are not satisfied with that duration.
Okay.
Antibiotics and other tablets can give.
Mm-hmm. Why budesonide not suitable for a short duration of time?
It's a symptom preventers
Mm-hmm.
and take more times for your action.
Mm-hmm. Okay. What are the symptom preventers and relievers do you know we are using in asthma management?
Symptom relievers are salbutamol,
Mm-hmm.
theophylline,
Mm-hmm.
and antimuscarinic like etopium bromide, tiotropium bromide.
Mm-hmm.
System preventers are antihistamine like
Mm-hmm.
cetirizine,
Mm-hmm.
montelukast,
Mm-hmm.
leukotriene antagonist.
Is cetirizine is a symptom preventable? Sure.
Antihistamine
Or we use antihistamines as preventers? Mm-hmm. Okay. Tell me what are the essential advices that you should provide when dispensing a drug like a budesonide? Sorry, ළමයි පොඩි disconnection එකක් ආවා. Sorry පුතේ, I will give the time, okay? පොඩි
okay.
disconnection එකක් ආවා. I was asking what are the essential advices that you should provide when dispensing drug like a budesonide?
Sorry, sir.
I was asking Puta, what are the essential advices that you should provide when dispensing drug like a budesonide?
Firstly, get MDI
Mm-hmm.
and shake before use.
Mm-hmm.
Remove the mouthpiece
Mm-hmm.
and exhale fully.
Mm-hmm.
MDI use upright position
Mm-hmm.
and keep the lips and tightly closed.
Mm-hmm.
Inhale through when pressing canister
Mm-hmm.
and keep 10 seconds about breathe. After
Mm-hmm.
breathe out slowly.
Mm-hmm.
If more than dose recommend and repeat once.
Mm-hmm. Okay. Then tell me what are the side effects that we are expecting with budesonide use?
Can cause oral candidiatis, hoarseness of voice,
Mm-hmm.
like that.
Mm-hmm. Okay. What are the other inhaled corticosteroid do you know?
Formiprol, salmeprol,
Are formoterol and salmeterol are inhaled corticosteroid? Are they?
Now, corticosteroid and budesonide.
As you mentioned, formoterol and salmeterol are long-acting beta-2 agonists. They are not inhaled corticosteroid. What are the
Yes, sir.
inhaled corticosteroid that do you know?
Fluticasone.
Mm-hmm.
That's I remember, sir.
Mm-hmm. Okay. Tell me about beta-2 agonists, Pata. Mainly when we considering inhaled forms, what are the beta-2 agonists that do you know? I'm asking about beta-2 agonists.
Salmeterol,
Mm-hmm.
salbutamol,
Mm-hmm.
formoterol,
Mm-hmm.
like that.
Okay. What are the common side effects that we are expecting with beta-2 agonists?
Like tremor, tachycardia.
Mm-hmm. Mm-hmm. There is another deficiency in these prescriptions. You didn't point out that, Putta. What do you think about theophylline dose and the frequency with the dosage?
Theophylline dose and frequency, high frequency prescribed. Normally, twice a daily dose is compatible.
Mm-hmm. Why, Putta?
It is a slow release dosage form.
Mm-hmm.
Mainly used at nocturnal attacks like symptoms.
Mm-hmm. Okay. I was asking a lot of questions from one prescription, so I am not moving for the another one, Putta. Okay, I am moving with the product. What is this product with the under image number 2?
This is a betazole nasal drop. Betazole eye and ear and nasal drop.
Mm-hmm. Okay. Is this available in your pharmacy?
Yes, sir, available.
Mm-hmm. What are the other eye ear nasal drops available in your pharmacy?
Um, we have timolol eye drop and normal saline nasal drop.
Mm-hmm. Tell me patient advices for this particular product when you dispensing for a patient to use as eye drop.
First, wash your hands
Mm-hmm.
and open the bottle, rubber bottle. Look up and till overlay down. Put
Mm-hmm.
prescribed dose without touching the drop on eye.
Mm-hmm.
And close eye about 5 minutes.
Mm-hmm.
Can wipe excess fluid on tissue.
Mm-hmm.
After more than eye drop use, uh, should maintain 5 minutes gap each other.
Mm-hmm. Any other specific advices that you should mention? How do you advise for the patient regarding opening the dosage form including container?
Uh, return the I not remember exactly now.
Mhm. Okay, Puta. Tell me, what are you going to do in this particular scenario? A patient came to your pharmacy. He or she doesn't have a prescription, and asking for a Firiton 20 tablet. What are you going to do?
20 tablets can't be dispensed
Mm-hmm.
because it will to be necessary for prescription.
Mm-hmm.
In this situation, we can issue 1 or 2 doses if necessary of patient,
Mm-hmm. Why?
but last dose cannot dispense.
Why that you are telling prescription is necessary for Firiton like drug?
Piriton is a schedule to be medicine.
Mhm. Okay.
It's an MR record.
What are the other drug schedules? Do you know and describe those little bit?
Schedule 2 bits.
I mean all the schedules. As you know, what are the
Okay.
schedules according to NMRA regulations?
Yes. Schedule 1.
Mm-hmm.
No need prescription and sell any place.
Mm-hmm.
Low risk medicine. It has like paracetamol blister pack,
Mm-hmm.
Panadol syrup. Another one, schedule 2,
Mm-hmm.
2A medicine. It's not necessary of prescription, but sell at only pharmacy in under supervision by pharmacist.
Mm-hmm.
Example, analgesic balm,
Mm-hmm.
multivitamin,
Mm-hmm.
cough syrup not containing codeine.
Mm-hmm.
Another one, schedule 2B,
Mm-hmm.
prescription only medicine,
Mm-hmm.
and should supervision master pharmacist.
Mm-hmm.
Example, antihistamine, antibiotics,
Mm-hmm.
antipsychotic drugs.
Mm-hmm.
Another schedule is schedule 2.
Mm-hmm.
It's necessary to prescription and place is designed by the authority.
Mm-hmm.
Example, smoking tablet, tramadol tablets. Another schedule is schedule 3.
Mm-hmm.
It's a maintain another law, Persian opium and dangerous drug ordinance.
Mm-hmm.
It's contain morphine injection like that.
Mm-hmm. Is Schedule 3 drugs are available in your pharmacy?
No, so schedule 2C and schedule 3 not available in your pharmacy.
Mm-hmm. Okay. What are the special precautions that we should follow when handling Schedule 3 drugs?
It should be maintained record this improperly.
Mm-hmm.
And is to separate area from other medication,
Mm-hmm.
restrict others, and it should be kept under supervision by pharmacist.
Mm-hmm.
It should be lock and key, like this.
Mm-hmm. Okay, but your time almost over. I think miss time almost covered. මාක්ස් ඔක්කොම එකට දාන්න ළමයි පුතාගේ සමහර තැන් තියෙනවා පැටලෑන තැන් කම්පියුටර්ස් නැති ගතිය තියෙනවා පුතා වයිව ෆේස් කරලා නෑනේ කලින් ෆස්ට් ටයිම් නේ
That's the first time.
ඒක තමයි හරිය ප්‍රැක්ටිස් කරද්දි තව ටිකක් ප්‍රැක්ටිස් කරන්න යාළුවෙක් එක්ක හරි කමන්නේ අපේ ඊළඟ සෙෂන්ස් වලත් බලමු කම්පියුටර්ස් පොඩ්ඩක් අඩු ගතියක් තියෙනවා සමහර තැන් පැටලෑන ගතියක් තියෙනවා patient advices වල flow එක තියෙනවා හැබැයි සමහර තැන් ක්ලියර් නෑ ඒ නිසා ඒ ටික චුට්ටක් හදාගන්න වෙයි අර ගොඩ දාගන්න පුළුවන් හැබැයි අපි හොඳ ස්කෝර් එකකට යනවා නම් තව ටිකක් උනන්දු වෙන්න ඕන
Okay, so thank you.
ඊළඟට ළමයි 1969.
Yes, sir.
හරි. Shall we start පුතා?
Okay, sir.
Mhm. Okay. What is your name and where are you from පුතා?
I am Fatima Zuha from Kandy.
Wait a minute පුතා. Something wrong with
Yes.
the clock. I will give the time පුතා. Okay. Give me a minute. ඔය ටයිම් එක ඔන් කරන්න බෑ මොකක් හරි ඉෂුව එකක් තියෙනවා මම එක්ස්ටර්නලි ටයිම් එක තියාගන්නවා ඔයාලා ටයිම් එකට මම කියන්නම් ගැටලුවක් නැහැ ඔයගොල්ලෝ ආන්සර් කරන් යන්න ටයිම් එක තියෙනවා නම් ආයේ රීස්ටාර්ට් එකක් ඉල්ලනවා ඒක කරන්න ගියොත් අපිට වැඩේ කරගන්න වෙන්නේ නැහැ ඒ නිසා මම එක්ස්ටර්නලි තියාගන්නවා ටයිම් එක ආවම මම කියන්නම් හරි shall we start පුතා
Okay, sir.
okay what is your name and where are you from පුතා
I am Fatima Zuha from Kandy.
where is it your pharmacy located පුතා
In Buvelikada, sir.
okay is it a city or a village area?
Not a city, sir. Rural area.
How many numbers of prescriptions are per day coming for your farms?
Not more than 15, sir.
Okay. Okay, you can choose one prescription from this slide, Puta, as you wish.
Prescription.
Choose fast, Puta. You don't have much time.
Prescription 1, sir.
Okay, what do you think about prescription number 1? Can you dispense?
No, sir. Doctor's signature is not there.
Okay. If prescriber signature is available in here, are you going to dispense?
No, sir, because prednisolone we can't dispense like that. It has a dosage regimen. It should be reduced doses as it is for 3 months.
Okay. Why prednisolone dose tailing off is essential?
It is a corticosteroid. Usually it is tail off dosage form is given. If it is stopped suddenly, it can cause to some systemic side effects and also immune problems.
What kind of side effect?
Immunosuppression. The patient might get some diseases very quickly because her or his immune system will be so poor.
There is a specific term for that condition. We call it acute adrenal insufficiency. That is the term, okay?
Yes.
Okay. What are the other corticosteroids that do you know?
Baclomethasone, budesonide, fluticasone.
Okay. What kind of side effect that we are expecting with long-term use of corticosteroid? I highlighted long-term uses.
Growth retardation can happen, sir.
Any other?
Adrenal gland suppression, and skin problems.
What kind of skin problems?
Photosensitivity.
Is corticosteroid has high risk for photosensitive reactions?
If exposed to sunlight with the treatment of corticosteroids, it can happen.
Very rare, it is not a common one. Okay, what are the other drugs that do you know known to cause photosensitive reactions?
Um, uh, doxycycline.
Any other?
Mm, Can't remember now, sir.
Mhm. Okay, what are the common indications for corticosteroid?
Inhaled corticosteroids for long-term asthma, um, and other corticosteroids for arthritis conditions.
Any other indication?
Mm. As immunosuppression, we use the corticosteroids.
Mhm. Okay, what do you think about prescription number 4 for that?
Mm. Patient's age is not mentioned. Mm. And there is a drug interaction, as this patient might have hypertension. Hypertension drugs are prescribed. With that, sildenafil is prescribed. It can cause sudden hypotension, which lead to death.
There is a particular drug here that interact with the sildenafil. What is that?
Isobide mononitrate SR tablets.
Is there any other interactions or a deficiency in this prescription rather than the sildenafil and ISMN issue?
Losartan potassium and spironolactone. Losartan potassium is which release potassium to the blood, and spironolactone also potassium sparing diuretic, so it can cause hyperkalemia.
What do you think about losartan and lisinopril together? Is it rational?
Uh, no, sir. AC inhibitor and ARB. Uh, it is not given with combination.
What happen when we use the combine or the combination?
Hypotension can happen.
Only the hypertension. There is a specific risk. That's why we are not using. They can affect on kidneys because both drugs are acting on renin-angiotensin systems. That's why we are not combined.
Okay.
Okay, then what do you think about lisinopril dose and the frequency?
Not given. This one of it. Thrice daily is not given, sir. It is once daily dose.
So you didn't recognize that at first place, no? Okay.
Yes.
Tell me about sildenafil.
Sildenafil is commonly used for erectile dysfunction. For the erectile dysfunction, it is a prescription only drug. It should not be given with the patients with hypertension treatment.
What is the drug group?
Uh, Sildenafil. Mm,
What we call it?
I'm not sure.
Do you know about
Uh,
phosphodiesterase inhibitors? Hmm. Is there any other
yes, sir.
indications rather than the electrile dysfunctions for the sildenafil?
As I remember now, only for the erectile dysfunction.
No, Pata. Primarily, this drug was designed for the heart failure, but recently we are using for the pulmonary hypertension as well. Okay?
Okay, sir.
Not only for the erectile dysfunction. Okay.
Okay, sir.
Okay. I am moving with a product, Pata. Okay. Tell me about this image number 5 included device. What is this?
Foley catheter.
Mhm. Is this available in your pharmacy?
Yes, sir.
Mhm. What are the primary uses for this catheter?
Patients who can't pass urine as usual,
Mhm.
for those purposes, we use this one.
Mhm. What are the specifications of this particular device or the catheter?
Sir, I couldn't hear.
What are the specifications of this particular catheter or the device? I'm asking about the specifications.
It is a once only usage.
Mhm.
If the pack is broken or damaged or open, we can't use it. Sterile device.
Mhm. Okay, then tell me, Puta, what are the legal documents that you are maintaining in your pharmacy as you study during your apprenticeship?
Prescription book.
Mhm.
And temperature recording book.
Mhm.
Rather than that, for the some dangerous drugs like pregabalin and all, we have a separate books.
Mhm. Okay, who is monitoring those documents?
Our chief pharmacist.
I'm asking about the monitoring role, Puta. Chief pharmacist do maintaining.
Yeah, the people who come from NMRA and also the public health inspector.
Are you sure?
Yes, sir.
Is it public health inspector or the food and drug inspector?
Food and drug inspector.
Yeah. Okay. Who are the authorized officers that do you know as per the NMRA Act and the regulations?
Food and drug officer and also mm, person officers from NMR.
Any other? What about the divisional pharmacies, provincial pharmacies, and
Provincial pharmacist? Yes, sir. They also include.
Yes, medical officer of health, etc. Okay. Tell me about responsibilities of a responsible pharmacist.
Uh, he or she should be at the pharmacy uh, in the dispensing hours, and he is responsible for all the activities in the pharmacy. uh, should maintain records, and also the storage, temperature, and other activities of the pharmacy, and maintaining inventory and disposal of expired drugs.
Mhm.
For those are the main responsibilities of the pharmacist. Mm,
Mhm.
Rather than that, receiving the prescriptions, and also responsible for all prescriptions dispensed by uh, their pharmacy,
Mhm.
and he should monitor the others when dispensing.
Mhm. Okay, Pita, your time almost over.
Okay.
Briefly out. දාගෙත් සමහර තැන්වල හිරවෙන තැන් තිබ්බ සහ සමහර ඒවා චුට්ටක් තියෙනවා ෆස්ට් ටයිම් නිසා වෙන්න සමහර විට තව ටික අපි ඉම්ප්‍රූව් කරගමු හොඳ ලකුණකට යනවා නම් සර්වයිව් වෙන්න පුළුවන් හැබැයි අර හොඳ ලකුණකට යනවා නම් තව ඉම්ප්‍රූව් වෙන්න ඕන සමහර තැන් තියෙනවා අන්ක්ලියර් සහ පොඩ්ඩක් රෙස්පොන්සස් ලේට් වෙන ඒවාත් තියෙනවා අපි ඉස්සරහට බලමු
Okay, sir. Thank you.
හරි ඊළඟට තමයි 151 මම ඔයගලන්ට එක් හැමෝටම විනාඩි 20ක් ඇලෝකේට් කරලා තියෙන ළමයි 15 ගියාම සමහරයට කමෙන්ට් එක දෙන්න එච්චර ලොකු කාලයක් යන්නේ නැති නිසා සමහරයට ඔයාලගේ ස්ලොට් එක චුට්ටක් දාලා තියෙන ටයිම් එකට වඩා විනාඩි 5ක් විතර එන්න පුළුවන් ඉස්සරහට ඒක නිසා චුට්ටක් කලින් ජොයින් වෙලා ඉන්න වෙලාවටම ඉන්න බලාගෙන ඉන්න එපා එයාගේ ස්ලොට් එක තිබ්බ 7:55 ඉඳන් 8යි කාලේ වෙනකන් ඒක නිසා දන්නේ නැත්තේ ඉන්නවද ළමයි 151 ළමයි හරි අපි බලමු එයා ජොයින් වෙනකන් චූටි වෙලාව ඒ අතර මොනවද ප්‍රශ්න තියෙනවා නම් නිරාකරණය කරගන්න අහන්න පුළුවන් වයිව් එක ෆ්ලෝ වෙන්නේ ඔහොම තමයි I can try කියලා කියනවා අපි බලමු පුතේ මෙයා ආවේ නැතොත් ඔයාට දෙන්න chance එක මෙයා ස්ලොට් එක දාලා තිබ්බ වෙලාව හින්දා බලන් ඉන්නවද දන්නේ නැහැ ජොයින් වෙන්න අපි බලමු චුට්ටක් බලමු ඒ අතර ඔයාලට ගැටලු තියෙනවා නම් ඔයාලට තේරෙනවා දැන් වයිව් එක යන්නේ ෆ්ලෝ වෙන්නේ කොහොමද කියලා ළමයි ගොඩක් වෙලාවට ඔයාගේ ආන්සරින් එක තමයි ක්වෙස්චන්ස් බිල්ඩ් වෙන්නේ. දැන් මෙතන මම ඔයාගෙන් අහපු එක ක්වෙස්චන් එකක්වත් ෆ්‍රී ඩිටර්මයින් කරලා නැහැ. මෙයා ඔයාගෙන් අහන්නේ මේකද කියලා. ෆ්ලෝ එකත් එක්ක අහන්නේ ක්වෙස්චන්ස්. එතකොට ඔයාලට තේරෙනවා වයිවා කියන්නේ මොකක්ද කියන එක. එතකොට සමාජයට තමන් කියන එකම තමන්ට අවාසි වෙන්න පුළුවන්. ඒක ෆ්ලෝ එක එක්ක යන්නේ වයිවා එක. එතනත් එහෙම තමයි එක්සැමිනර්ස්ලා ෆී ඩිටර්මයින් කරලා නැහැ. ප්‍රෙස්ක්‍රිප්ෂන් ප්‍රොඩක්ට් වගේ ඒවා තියලා තියෙනවා. ඒක හරි. ඒවක ක්වෙස්චන්ස් අහගෙන යනවා ෆ්ලෝ එක එක්ක තමයි ක්වෙස්චන්ස් අහන්නේ. එතකොට ඔයාට අයිඩියා එක තියෙන්න ඕන මැනේජ් කරගන්න. ගැටලු තියෙනවා ළමයි චුට්ටක් මේ බලන්න අර ළමයා ජොයින් නේද කියලා. එයාගේ ස්ලොට් එක තියෙන 7:55 8යි කාල වෙනකන් අපි දාලා ඒ වෙලාවට එන්න ඉන්නත් දන්න. ස්ලොට් නම් මිස් කරගන්න එපා ළමයි. ඒක මහා අනිත් අයටත් කරන අසාධාරණ අපරාධයක් ඕගොල්ලෝ. ගත්ත ස්ලොට් එකට එන්න ගන්නට. මොකද එහෙම වුණා අවුල් වෙනවා. කොහොද 60ක් ඉන්න එක කීයේ දෙන්නේ 30ක්වත් නැහැ. 28යි ඉන්නේ මාත් එක්කනේ ඉසිනම්. දන්න වුවමනාව තියෙන්න ඕන ළමයි වැඩක් කරනකොට වයිවා අර අපි රිවිෂන් කරා වගේ එහෙම නැත්තම් ඔස්පි කරා වගේ රෙකෝඩින් එක බලලා හෝ ඒව කරලා කරගන්න අමාරුයි. ඔයාලට තේරෙනවනේ ඔයාලා කතා කරන්න ගියාම කොච්චර ස්ට්‍රගල් කරනවද කියලා. දැන් මෙතන මම දන්නවා හොඳටම නොලෙජ් එකේ තියෙන ළමයි ඉන්නවා. කතා කරන්නදී ස්ට්‍රගල් කරනවනේ. ඒක අනිවාර්යෙන් වෙනවා. වයිවා is not about the knowledge ළමයි. ඒක ඔයා ආන්සර් කරන විදිය කතා කරන විදිය හදාගෙන යන එකත් එක්ක තමයි ඕවරෝල් මාක් වාගේ තීරණය වෙන්නේ.
සර්
ඔව්.
සර් ඔය කියන්නේ වීටසෝල් nasal drop වල opening specific කියලා ඒකට mean කරන්න මොකද sir?
Opening කරන්න there is a mechanism පුතාන in the lid lid එක එක පැත්තකට කරකවපුවම පුතේ ඒක අර function වෙනවනේ. දැන් අපි patient එක කියන්නේ නැහනේ මූඩි ඇරලා කට්ටකින් හිල් කරන්න කියලා lid එක. ඒකේ there is a specific mechanism for the opening. අපි එක පැත්තකට කරකවපුවම යටට දාලා ඒක ටෝ function වෙනවා පුතේ. ඒක තමයි අහන්නේ opening mechanism. drop bottle වල එක තියෙනවා. advices කියද්දි ඒක කියන්න ළමයි. ගොඩක් අය කියන්නේ නැහැ. බෝඩ්ලයින් ප්‍රොඩක්ට් එක රියල් අන්ඩර්ස්ටෑන්ඩ් ගොඩක් වෙලාට කම්බයින් කැරක්ටරිස්ටික් තියෙනවා තමයි අපි බෝඩ්ලයින් ප්‍රොඩක්ට්ස් විදිහට කැටගරයිස් කරන්න ළමයි ෆුඩ් ඕ ඩ්‍රග්ස් ඕ කොස්මැටික් එක සිම්පල් මීනින් එක ඕක හැබැයි ඕකේ කැටගරයිසේෂන් එකක් තියෙනවා ඩ්‍රග්ස් වගේම ෂෙඩියුල් වයිස් සමහර ඒවා තියෙනවා ප්‍රෙස්ක්‍රිප්ෂන් නැතුව දෙන්න පුළුවන් ඒවා සමහර ඒවා ප්‍රෙස්ක්‍රිප්ෂන් ඔන්ලි ඒවා තියෙනවා සාමාන්‍ය අපිට ඒ වගේ රෆ් අයිඩියා එකක් තියාගන්න පුළුවන් කියන්නේ අපිට ඩ්‍රග්ස් විදිහටත් දාන්න බැරි ඩිවයිසස් විදිහටත් දාන්න බැරි ෆුඩ් විදිහට හෝ කොස්මැටික් විදිහට දාන්න බැරි කම්බයින් කැරක්ටරිස්ටික් තියෙන ඒවා ප්‍රොඩක්ට්ස් තියෙනවා ඒවට තමයි අපි ගොඩක් කරලා බෝඩ්ලයින් ප්‍රොඩක්ට්ස්
ඒක hyperpigmentation වල use කරන්න creams ලා ඒක borderline ද melasma වගේ
ගොඩක් වෙලාවට බෝඩ්ලයින් ගන්න පුළුවන් පුතේ හැබැයි කොස්මැටික් වල රෙගියුලේෂන්ස් ගොඩාක් කම්ප්ලිකේටඩ් ළමයි ඒ නිසා අපිට කොස්මැටික් සයිඩ් එකේ එන ඒවා ගොඩාක් වෙලාවට හරි අමාරුයි කැටගරයිසේෂන්ස් කරන්න ඒක නිසා ඒ වගේ ඒවා ලොකුවට කමෙන්ට් කරන්න යන්න එපා එක්සැම්පල් ඇහුවත් ඔය කොමන්ට් ටිකක් කියන්න මීතල් සැලිසිලේට් ජෙල් ඒවා බෝඩ්ලයින් නෙමෙයි පුතේ ඒවා ඇවිල්ලා API එකක් තියෙන ඒවා ඇවිල්ලා ඩ්‍රග්ස් විදිහට වී කන්සිඩර් මීතල් සැලිසිලේට් ජෙල් එක ඩ්‍රග් එකක් විදිහට කන්සිඩර් කරන්න බෝඩ්ලයින් නෙමෙයි
MDI කියන්න පුළුවන්ද
MDI බෝඩ්ලයින් කියන්න බෑ MDIs අපි කන්සිඩර් කරන්නේ ඩ්‍රග් එකක් විදිහට නෙමෙයි ඩිවයිස් එකක් විදිහට මීල් ඩෝස් එක ඒක ඇතුලේ තියෙන එක තමයි ඩ්‍රග් එක. එතකොට ඒක ඇවිල්ලා ජස්ට් ඩ්‍රග් එක ඉන්ක්ලූඩ් කරලා තියෙන කන්ටේනර් එක ටයිප් එකට තමයි MDI එක කියන්නේ. ඒ කියන්නේ ඒ ඩ්‍රග් එක ඩිලිවර් කරන kind of device.
So then clotrimazole powder with a sifter top. That one's clotrimazole is a drug.
Yes.
But what category do they really belong, sir?
Drugs tamavati. Those are belong to the drugs. If any of particular product containing usual APIs that we know, like corticosteroid or methyl salicylate, they are belong to the drugs, not borderline product. If they combine with some kind of devices or some kind of combined characteristic, it may define as a borderline product, but majority is considered as drugs.
Sir, is clotrimazole powder available there?
Yes, available Pradhane. We are using for the nails or some kind of fungal issues. Powders are using.
Dusting powder.
Yes, not famous but using. හරි ඉන්නවද පුතේ කවුද අපේ ඊළඟ තියෙන ස්ලොට් එක 150ක ඉන්නවද ළමයි?
ඔව් සර්.
හරි. Shall we start with the
Yes sir.
What is your name and where are you from, Putra?
My name is Anu Vidhi. I am from Polonnaru.
What is your pharmacy, Putra?
My pharmacy is Subodha Pharmacy, Madiriya.
Okay. Is this your first attempt?
No sir, this is fourth attempt.
Okay, choose one prescription from this slide, Putra. Uh, 4 and 3 you already discussed. You can choose between 1 and 2.
Prescription 1.
What do you think about prescription number 1?
Mm, I think this prescription is genuine prescription.
Hmm. You
Prescribed
think
for 16 years children.
you think this one is genuine?
Yes.
Mhm. What about the doses of 2 MDIs and also the Montelukast frequency?
Uh, Beclomethasone is this prescription is 200 milligram.
Mhm.
It should be a microgram.
So you didn't notice that, no? What do you think about Montelukast Manidos?
Montelukast normally nocte doses.
Are you sure? Is it Nocte or Vesper? We use it
I
as
think
evening doses, but are not Nocte. Why we use Montelukast as evening doses?
I'm not remember this time.
Okay, what is the drug group for the Montelukast?
Xanthine derivatives.
Are you sure?
Yes.
This is not a xanthine derivative. What we call this? Do you know about leukotriene receptor antagonists?
Yes.
This drug belong to that group. What are the xanthine derivatives that do you know?
Theophylline.
Okay. What are the common indications for Montelukast?
Acute asthma.
Any other? You use the term as acute asthma. It is critical term. Is this drug beneficial or used in acute conditions of asthma? What kind of drugs that we usually use in acute management?
Bronchodilators.
What kind of bronchodilators?
Short acting.
Tell me an example.
Salbutamol.
Okay. What are the patient advices that you should mention when dispensing Montelukast like drug?
Can't remember.
Okay. What are the possible side effects for Montelukast?
Palpitation.
Palpitation.
Drowsiness.
Is Montelukast known to cause palpitation? Okay, then tell me patient advices for salbutamol MDI. What are the advices that you should mention when dispensing salbutamol MDI?
Salbutamol MDI used for use in acute attacks. If you are using this device, first exhale air from mouth and keep meter dose inhaler between teeth around lips and press the canister and then inhale.
That's only. Any other advices? Okay, then tell me about prescription number 2, Puta. Are you going to dispense according to this?
Yes, sir.
Okay, are you sure?
Yes.
What is the first drug here with?
Sodium valproate tablet.
What is the drug group that sodium valproate belong?
Sodium valproate is anti-epileptic drug.
Okay. What are the common side effects that we are expecting with sodium valproate use?
Gingival hypertrophy, osteomalacia, weight gain, hair loss and curly hair growth,
What are the patient advices that you should mention when dispensing sodium valproate?
take sodium valproate tablets with water. Do not crush the tablet or shave the tablet. Do not stop suddenly when disease is cured. Don't change the brands without prescriber authorization.
Why we shouldn't change the brand? What happens if we change the brand?
Various brands may cause various side effects. Usual
Various side effects. How that could happen? There is same API in the both brands. Sodium valproate.
some excipients are not compatible with patient.
Okay. Why folic acid is in this prescription? And also vitamin B12?
Sodium valproate cause vitamin B deficiency. So folic acid and vitamin B12 prescribed.
Okay, Buddha, tell me what are the semi-solid dosage form available in your pharmacy?
aqueous cream,
Mhm.
povid,
I am not asking
povidone
about product, but I am asking about dosage. What are the semi-solid dosage forms that available in your farm?
creams,
Mm-hmm.
suppository,
Mm-hmm.
paste.
Any other? What about ointment paste?
Yes, ointments.
Hmm. Tell me few examples for ointments and face and also the creams available in your farms.
Povidone ointment,
Mm-hmm.
mechanizole cream,
Mm-hmm.
aqueous cream,
Mm-hmm.
fusidic acid cream,
Mm-hmm.
fusidic acid ointment.
Mm-hmm. Okay, what is the main difference between an ointment and a paste?
Ointment is actually oily preparation.
Mm-hmm.
Paste contain more solid ingredients. More solid ingredients than ointment.
Mm-hmm. Okay, tell me about the functions of National Medicine Quality Assurance Laboratory. As you know, what are the functions?
Quality control and quality assurance of medicine, medical device, and borderline products.
Mm-hmm. Okay, can you further explain little bit more?
Mm, Not remember.
Mm-hmm. Okay, then tell me about the functions of SPC, State Pharmaceutical Corporation. SPC.
SPC is a sole importer of drugs in Sri Lanka for affordable prices. Introduction medicines, outlets for affordable prices of medicines in Rajya also Salas.
Mm-hmm.
And quality assurance.
Mm-hmm. Okay, your time almost over, Buta. We'll see.
Thank you, sir.
මම දැන් ගොඩකල් ටච් එක නැති නිසා තමයි මට මතකයි පුතා ඊට කලින් වයවල ඉඳලා තියෙනවා ටච් එක ගිහිල්ලා තියෙනවා සමහර තැන් අවුල් යනවා හිර වෙනවා මතක නැහැ ඒක නිසා හදාගන්න වෙයි අපි ඉස්සරහට ඒවා බලමු ගොඩ අඩුපාඩු තියෙනවා කියන්නේ ගොඩක් රීසන් වල අඩුපාඩු තියෙනවා පොඩ්ඩක් හදාගන්න පුතා අපරාධය කලින් මම මතක විදියට එක ගාන පුතාට ඒකක් තිබ්බනේ
සර්වයිවල්ට ඒ
ඒ
තිබ්බා
තිබ්බනේ
මේ
අපරාධය හදාගන්න දැන් ටච් එක ගිහිල්ලා තියෙනවා
ෂයි තුනේම සර්වයිව යනකනුත් ගියා ඒත්
හදාගන්න
ලියන්න
අපරාධය හදාගන්න හරි හරි බ්‍රෑන්ඩ් සබ්ස්ටිටියුට් කරන්න බැරි අය අහනවා. සබ්ස්ටිටියුට් කරන්න බැරි කමක් නෑ. do not substitute කියලා ගහලා තිබ්බොත් අපිට තියෙනවා එතන අර ethical boundary එකක්. prescriber substitute කරන්න එපා කියද්දි අපිට substitute කරන්න බෑ. එහෙම generic substitutions කරලා බෑ. හැබැයි අර උඩ එකේ තහ දෙන පුතේ ඒ ප්‍රශ්නේම තමයි තයිරොක්සින් වල බ්‍රෑන්ඩ් එක ඇයි චේන්ජ් කරන්න බැරි කියලා. particular drugs වලට ළමයි ගොඩක් වෙලාවට තයිරොක්සින් එතනින් ගියාම ඔය ඇන්ටිෆිලෙප්ටික් වගේ ඒවට අපි ගොඩක් වෙලාවට බ්‍රෑන්ඩ් එක සඩන්ලි චේන්ජ් කරන්න එපා කියලා ඇඩ්වයිස් කරනවා අපි රීසන්ලි. ඇයි ළමයි? නිකන් සයිඩ් ඉෆෙක්ට්වත් ඒවා නෙමෙයි ඒවා ඇවිල්ලා ෆේරි ටේල්ස් වගේ. ඒ සයිම් නෙමෙයි. ඇක්චුවල් රීසන් එක මොකද්ද ළමයි?
Dose
May
reducing
reduce
rates
the
වෙනස්.
bioavailability of the drug.
sorry.
Bioavailability change.
very good. එතෙන්ට තමයි එන්නේ. ඔයාලා දන්නවා ළමයා මාකට් එකට අපි ප්‍රොඩක්ට් එකක් දාද්දි ඉනෝවේටර් ප්‍රොඩක්ට් එකක් එක්ක මොකක් කරලාද දාන්නේ? අපි ඒකට කියන්නේ මොකද්ද? මොන ස්ටඩීස් කියලාද? අපි කියනවා බයෝ ඉක්වලන්ස් ස්ටඩීස් කියලා. එතකොට බයෝ ඉක්වලන්ස් එක තියෙනවා නම් තමයි බයෝඅවැලබිලිටි එක කර්ව්ස් ස්ටඩි කරලා එක එක යනවා නම් තමයි ගොඩක් වෙලාවට ප්‍රොඩක්ට් ඇප්‍රූව් වෙන්නේ. හැබැයි අපි පර්ටිකියුලර් අපි හිතමු ඉනෝවේටර් බ්‍රෑන්ඩ් එකේ ඉන්නවා කියලා. ගොඩක් වෙලාවට බයෝඅවැලබිලිටි එක සේම් නෑ, පොඩි චේන්ජ් එකක් තියෙනවා. එතකොට අපි ගොඩක් වෙලාවට සෙන්සිටිව් ඩ්‍රග්ස් යූස් කරද්දී බයෝඅවැලබිලිටි එක අපේ සර්කියුලේෂන් එකේ ස්ට්‍රික්ට්ලි තියෙන්න ඕනේ ඒවා. ගොඩක් වෙලාවට හෝමෝන් රීප්ලේස්මන්ට් සහ ඇන්ටිෆිලෙප්ටික් වගේ ඒවා ගත්තොත් මේවා සඩන් ඩෝස් බයෝඅවැලබිලිටි එක ඩ්‍රොප් වෙනවා එක්ක සමහරට ඉපිලෙප්ටික් ඇටැක් එකක් එන්න පුළුවන්. මේවා අර කියන්නේ threshold එක හරි sensitive ඩෝස් එකට එන්න පුළුවන්. තයිරොක්සින් හෝමෝන් රීප්ලේස්මන්ට් එකෙත් එහෙමයි. ඒකයි අපි ගොඩක් වෙලාවට බ්‍රෑන්ඩ් සබ්ස්ටිටියුෂන් එක රෙකමන්ඩ් කරන්නේ නැත්තේ ක්‍රියේටින් ඩ්‍රග්ස් වලට විතරයි. හැබැයි හැම එකටම නෙමෙයි. prescribers ලා ගහලා තියෙනවා do not substitute කියලා. අපිට ඒක ethically boundary එකක් තියෙනවා substitute කරන්න බෑ generic එක. හැබැයි as per the law NMRA අපිට generic substitutions කරන්න පුළුවන්. ඇයි particular ඒවට කරන්න ඒක කරන්න හොඳ නැත් සහ ඒක වෙන්නේ කොහොමද කියලා මම හිතනවා idea එකක් එන්නේ නැති කියලා. ඒක තියෙනවා නේද?
ගොඩක් කලට සර් ලෝං ටර්ම් යූස් කරන ඩ්‍රග්ස් වලට නේද එහෙම බ්‍රෑන්ඩ් එක මාරු කරන්න එපා කියන්නේ.
ගොඩක් වෙලාවට අපි
ගොඩාක් කල්
ගොඩක් වෙලා ලෝන් ටර්ම් සහ මේ වගේ අර ටික සෙන්සිටිව් ඩ්‍රග්ස් තියෙන පුතේ කියන්නේ ගොඩක් වෙලාවට ඩෝස් එකේ බයෝඅවැලබිලිටි එක පොඩ්ඩක් එහාම යහම වුණොත් ඒකෙන් අර consequences එන්න පුළුවන්. ඒ වගේ ඒවා තමයි සාමාන්‍යයෙන් අපි රෙකමන්ඩ් කරන්නේ.
ඕකේ සර්.
හරි ඊළඟට 1095 එනවා. Shall we start with it?
Good evening, sir.
Good evening. Okay. What is your name and where are you from, Putra?
My name is Alex Nirojan. I am from Jaffna.
Okay. What is your pharmacy, Putra?
My pharmacy is Thirinadana Murugan Pharmacy in Niliyadi.
Okay. You can choose one prescription from this slide, Putra, but already prescription 4 and 1, also the yes 1 and 4 already discussed.
So I choose prescription 3.
Okay, what do you think about prescription number 3?
So I have noted some interactions between ciprofloxacin and theophylline as a tablet. Ciprofloxacin is a hepatic enzyme inhibitor. Theophylline is a narrow therapeutic index medicine. Ciprofloxacin prescribing medication together can increase the toxicity of the theophylline tablet.
Okay, very good.
And also theophylline is a sustained release tablet, sir.
Mm-hmm. Mm-hmm. Okay, but tell me, is there any other deficiency rather than the theophylline and the ciprofloxacin issue?
I couldn't notice, sir.
What do you think about the aceclofenac and also the ibuprofen? Can we
Yes,
use
sir.
together?
These are two non-steroidal anti-inflammatory medications.
Mm-hmm.
Polypharmacy.
Mm-hmm. Okay. What are the other NSAIDs that do you know?
Diclofenac sodium.
Mm-hmm.
Ketoprofen, mefenamic acid, piroxicam, meloxicam.
Mm-hmm.
That's all I can recall now.
Mm-hmm. Okay. What are the common indications for NSAIDs?
Common indications for inflammation, pain, migraine,
Mm-hmm.
rheumatoid arthritis, osteoarthritis.
Okay. What are the common side effects that we are expecting with ibuprofen like NSAIDs?
The most common side effect is gastrointestinal ulceration, bleeding risk, and also hypertension because of the fluid retention.
Okay. What are the advices that you should mention for a patient when dispensing ibuprofen or a NSAID?
These are non-steroidal anti-inflammatory medicines. The patient needs to take the medication for the prescribed duration and the prescribed frequency. Do not double the dose. And also, it should be taken after food to prevent or to reduce the gastric disturbances. And if the patient misses a dose, do not double the dose. That's all I can remember, sir.
What do you think about ciprofloxacin and digoxin in this prescription? Are they compatible with each other?
They should not be taken concurrently because digoxin is an antacid which could reduce the absorption of antibiotics like ciprofloxacin.
Okay. How do you advise for the patient if you are going to dispense ciprofloxacin and digoxin together? As this
There should be a gap. Sorry, sir.
As
Sorry,
in
sir.
this prescription, as in this prescription. When you are dispensing ciprofloxacin.
Digoxin is mentioned SOS, which means it needs to be taken when necessary, and when taking ciprofloxacin, there should be a gap between the digoxin and ciprofloxacin, at least 2 hours gap.
Okay, what are the advices that you should mention when dispensing ciprofloxacin light drug?
Ciprofloxacin can cause photosensitivity, so the patient should be advised to avoid sunlight and wear protective cloth. And also it can cause tendinitis, so the patient should be warned about the pain in the tendons. If there are any pain in the tendon, he or she should inform to the doctor immediately and stop the medication. And do not massage in that area.
Okay, Pata. What is this product on the image number 3 here?
Is budesonide, British pharmacopoeia nasal spray.
Okay. What is the drug group?
Corticosteroids.
Okay. How many meter doses are available in this particular product?
Sorry, sir, I couldn't get it.
How many meter doses are
Sorry,
available
sir, I
in?
couldn't get the question.
How many meter doses are available in this product? I mean the doses. This is a FOPNO, so there is meter doses.
120 meter doses.
Okay. How do you advise for a patient regarding use of this particular dosage form? There is a specific way that you should advise for a patient.
Yeah. Before using the nasal spray, the patient should check the expiration date. Is there any damage on the container and package itself? And after that, wash the hands with soap and water thoroughly and dry them. After, the patient should tilt the head forward and insert the nostril. Before that, the patient should gently blow the air out. After that, instill the nozzle in one nose and close the other nose with the other hand. And at the pressing the nostril pump at the same time, the patient needs to inhale and wait for at least 10 seconds or 1 minute before exhaling. After that, wipe the nozzle cap with clean tissue and close the cap and wash the hands thoroughly.
Okay, very good. Okay, tell me, Puta, what are the refrigerated drugs that are available in your pharmacy?
Refrigerated tetanus toxoids, TT, insulin vials. That's all I can recall.
Okay, how do you manage and arrange your refrigerator as you study during your apprenticeship?
For cold chain preparations, we should maintain the cold chain products at 2 to 8 degrees centigrade in the middle compartment of the refrigerator. And we should not maintain any food items or any other items in the refrigerator. And also freeze products should be maintained in the freezer. Should not be maintained in the refrigerator door.
What is cold chain?
Cold chain is the process which is about the temperature. The product, the vaccine is maintained in the manufacture temperature from the point of manufacture to the point of administration to maintain its potency, strength, and quality.
Why temperature control is essential for this kind of heat sensitive or the biological products?
These are heat sensitive products, mainly proteins, and if they are exposed to high temperature or freezing temperature, they can be degraded or the protein can denaturate.
Okay, when a power outage going on, how do you manage your refrigerator?
We have about power backup systems, sir, and also we maintained ice cubes in our refrigerator and ice bottles in our refrigerator. Um, uh, and we do not open the refrigerator door unnecessarily, so which can maintain the temperature in the refrigerator. It's also
Mhm. Okay, you have a backup power source, no?
yes.
Mhm. Okay. Okay. Tell me, what are the advices that you should provide when dispensing a heat-sensitive biological product for a patient?
Heat sensitive biological product. When we are dispensing the heat sensitive biological products, it's usually in a cold boxes, and the patient needs to be advised to store the products away from heat and direct sunlight. Also, keep outreach of children. And the product is, if it is for refrigerator product, it should be maintained in the middle compartment of the refrigerator, away from freezing, and do not store in the on the door.
Mhm. Okay. Tell me about how do you manage and control the temperature inside your pharmacy?
To maintain temperature, so we have air conditioning system. It runs 24/7. It runs 24/7, and the temperature is maintained between 15 to 25 degrees centigrade at room temperature, as mentioned in the National Medicines Regulatory Authority. And also, uh, 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 uh,
Yes, sir.
so
Mhm. Okay, Putha. Your time almost over. We'll see. Almost ගැල්වන්න අපතේ
thanks.
clear answer කරනවා සහ patient advisors හොඳට කියනවා. පොඩි පොඩි තැන් තියෙනවා සමහර තැන් මිස් වෙන තැන් සහ answer කරගන්න බැරිච්ච ඒවා හදාගත්තාම හොඳයි. සාමාන්‍ය ඒවා හදාගත්තොත් හොඳ score එකකට යන්න පුළුවන්. අපි තව practice කරනකොට හරියයි.
So, excuse me.
අවුද.
Sir, in the case of cold boxes, if we are not dispensing in the cold boxes, we can fill the shopping bag with cold water and we can dispense, no, sir?
Yes, it is kind of, but it is not recommended. Puthe. When we are dispensing, it should not directly contact with the ice. That's the point. No? Valve shouldn't contact with the ice. If we put the ice, we should use two separate containers.
What is the cold water, not the ice cubes?
All water is not recommended. We can't directly contact with the water or the ice. If we put in the container, it must be dual one. Okay, මම එහෙම කියන්න තමයි. සාමාන්‍ය ice pack එකට අපි දාලා දෙනවා ළමයි එහෙම. ඒක recommend කරන්නේ නැහැ directly contact වෙන්න බෑ. ගොඩක් වෙලාවට අපි එහෙම දානවා නම් දාන්න ඕනේ containers දෙකක ළම. එකක් දාලා ඒ container එක අඩියට ice pack එක දාලා ඒක උඩින් තියන්න ඕන secondary container එකක දාලා valve එක ඊට පස්සේ මේ whole system එකම එකට close කරන්න. සාමාන්‍ය ඒක තමයි recommended විදිය. water include කරන එක මේක recommended නෑ සාමාන්‍ය we are issuing with the ice cube. ප්‍රශ්න වර්ගයක් තියෙනවා නම් බලමු. brand එක substitute කරන්න බැරි අපි ඒක පැහැදිලි කරා. කරා පොලිමාමසි පොලිපාමසි වගේ තියෙනවට කමෙන්ට් කරනකොට ප්‍රස්ක්‍රිප්ෂන්ස් වල පරිස්සමෙන් කමෙන්ට් කරන්නම ඒගොල්ලෝ පින් පොයින්ට් කරලා අහනවා. හැබැයි ඉතින් අපිට කොමන් පොලිපාමසි අඳුරගත්ත හැකිනේ. අපි කතා කරන්නේ kind of පොලිපාමසි තියෙන ප්‍රස්ක්‍රිප්ෂන් ඇඩ්මින් ඩිස්පෙන්සින් වලදී අපි කතා කරා. එතකොට ඒව අනුව කමෙන්ට් කරන්න එකම ගෲප් එකේ දෙකක් තියෙනවා. එක ඒවට මෙන්ෂන් කරන්න පුළුවන්. සේම් තෙරපියුටික් පර්පසස් වලට තියෙන ඒවට ලොකුවටම කමෙන්ට් කරන්න යන්න එපා. ඒගොල්ලෝ පින් පොයින්ට් කරලා අහනවා නම් kind of කියලා කියන්නේ. පුතාගෙන් ඇහුවද පොලිෆාමසි කියලා ඇහුවාම so what කියලා ඇහුවද? ගිය ගමන ඇහුවද?
ඔව් සර්.
මොනවද තිබ්බේ පුතේ?
එක ඇන්ටිබයොටික් මෙක්‍රොලයිඩ් එකක් තිබ්බා. ඒකට ඇහුවා පොලිෆාමසි තියනවා නම් ප්‍රශ්න මොකද කියලා.
ඒ කියන්නේ ඒගොල්ලෝ ඒක එහෙම ලියන්න පුළුවන් වගේ තැනකද හිටියේ?
නෑ two antibiotics ලියනවා කියලා මං කිව්වා. ඒක පොලිෆාමසි කියලා. ඒක ප්‍රශ්න මොකද්ද කියලා පොලිෆාමසි තියනවා නම් මොන ප්‍රශ්න ඒක තමයි එයාලා ඇහුවා.
ඇන්ටිබයොටික් වගේ නම් අපිට කියන්න පුළුවන්. ඇන්ටිබයොටික් වගේ නම් අපිට කියන්න පුළුවන් irrational combinations drug resistant cause කරන්න පුළුවන් complications එහෙම කියන්න පුළුවන්. ඇන්ටිබයොටික් වගේ ඒවාට එහෙම කියන්න පුළුවන්. පොලිෆාමසි වලට කමෙන්ට් කරන්න නම් ගැටලුවක් නැහැ. ඒක ඔයා රෙකග්නයිස් කරනවා නම් දෙන්න ඇන්ටිබයොටික් උනත් අපි irrational combinations recommend කරන්නේ නැහැ. හරි. සාමාන්‍යයෙන් හොඳයි ඔයගොල්ලෝ ගොඩක් performance තියෙනවා. පළවෙනි පාර දෙවෙනි පාර තමයි ටික පොඩි ගතිය ඔයගොල්ලන්ට නර්වස් ගතියක් තියෙන ඊට පස්සේ හරියයි. ඒ නිසා දෙන chance එක ගන්න ප්‍රැක්ටිස් කරගන්න ප්‍රැක්ටිස් සෙෂන්ස් දෙකයි යන්නේ සතියකට. අද අන්තිමට එකට හොයාගත්තේ කවුරු එනම බලෙන් හරි. මම දන්නේ ඔයගොල්ලන්ට ප්‍රැක්ටිස් කරන්න නැත්නම් මට 100ක් 200ක් දාගෙන කැමැති අය කරන්න මම මෙච්චරයි දවසකට කරන්නේ කියලා කරන්න තිබුණා. එහෙම නැතුව හැමෝටම ප්‍රැක්ටිස් කරන්න chance එක දෙන්න ඕන නිසා තමයි limitations එක්ක කරන්නේ. ඒකේ ප්‍රයෝජනේ ගන්න ඉතින් ඔයගොල්ලෝ. එන කියන්නේ පොඩි ළමයි නෙමෙයි ළමයි ඔයගොල්ලෝ ඇඩල්ට් ස්ටුඩන්ට්ස් ලා. දේවල් තියෙන. හරි ඊළඟට ඔව්ද?
සර් කාට්‍රිජ් එක්ක දෙන්න මේ ඩිස්පෙන්ස් කරන්නේ අර විදිහටමද සර්? ඒ වගේ දාලා.
අන්ಓපන් කාර්ට්ලේජ් එකකට එහෙම ලොකු රිස්ක් එකක් තියනවද ළමයි? අන්ಓපන් එකකට.
මොනවටද සර් කෝල්ඩ් බොක්ස් දාන එකද?
කාර්ට්ලේජ් එක අපි හිතමු ඉන්සියුලින් එකක් කියලා. ඊවන් මිස්ට්‍රාඩ් වෑල් එකක් වුණත් අපිට සාමාන්‍යයෙන් ලොකු ටෙම්පරේචර් එකට ෆ්‍රැක්චුවේෂන් එකක් આવොත් තමයි රිස්ක් එකක් තියෙන රීගැඩේට් වෙන්න. නැත්නම් ඊවන් එකත් up to 1 month room temperature එක ස්ටේබල් වෙනම. හැබැයි අපිට මෙහෙමයි ඩිස්පෙන්ස් කරනකොට ටෙම්පරේචර් ෆ්ලක්චුවේෂන්ස් වෙන එක ඒක වෙනවාමයි ළමයි. ඒක නිසා අපිට ප්‍රෙඩික්ට් කරන්න බෑ මේක රූම් ටෙම්පරේචර් එකේ හැම වෙලේම තියෙනවා කියලා. ඒක නිසා අපි සාමාන්‍ය කාඩ්ලේජ් එකක් වුණත් වෑල් එකක් වුණත් අපි ඩිස්පෙන්ස් කරනකොට අපි ඒක අර රූම් ටෙම්පරේචර් එකේ තියනවා කියලා හිතලා නිකන් ඩිස්පෙන්ස් කරන එක රෙකමන්ඩ් කරන්නේ නැහැ. සාමාන්‍ය කෝල් බොක්ස් එකක් හෝ එහෙම නැත්නම් අර වගේ අයිස් කියුබ් දානවා නම් කන්ටේනර් එක ඒ විදිහට arrange කරලා ගම ඩිස්පෙන්ස් කරන එක රෙකමන්ඩ් කරන්නේ. මොකද අපිට කියන්න බෑ එයා patient මේක අරන් ගෙදරනේ යන්නේ. එයා බස් එකේ යනකොට ඒක ඇතුලේ තියෙන එක ටෙම්පරේචර් එකක්. එයා පාර යනකොට එකක්. එයා අපිට කියන්න බෑනේ අපේ ෆාමසි තියෙන කන්ඩිෂන් එක ඇතුලේම ඉන්නවා රූම් ටෙම්පරේචර් එකේ හැම වෙලේම ඉන්නවා කියලා. ෆ්ලක්චුවේෂන්ස් තියෙන්න පුළුවන්. ඒක නිසා අපිට එහෙම රෙකමන්ඩ් කරන්නේ නැහැ. එහෙම නැතුව ඩිස්පෙන්ස් කරන එක.
සර් මේ ඉස්කට් එකතු කරන පිළිවෙල පොඩ්ඩක් ආයේ කියලා දෙන්න බෑ. ඒක තියෙන තැනයි.
සාමාන්‍ය අපි දාන්නේ කන්ටේන් දැන් මෙහෙම හිතන්න ඕනම කන්ටේන් එකක් අපි නාඩියක් දෙන්න. ලොකු කන්ටේන් එකක් තියෙනවා විනාඩියක් දෙන්න. ඔයාලා අර ක්ලේ පොට් කන්සෙප්ට් එක දන්නවනේ ළමයිනේ. ක්ලේ පොට් එකේ අපි කොහොමද තියන්නේ? වෝටර් දාලා වෝටර් එක්ක ඩිරෙක්ට් කන්ටැක්ට් වෙන්න තියනවද ළමයි?
නෑ සර්. ඇතුළ තව චුට්ටක්
කන්ටේන
දාලා
එකක්
ඒක
දාලා තියන් ඒ ටෙක්නික් එකම තමයි යන්නේ. ගොඩක් වෙලා අපි හිතමු මේක කන්ටේනර් කියලා ලොකු එක. මේ ලොකු කන්ටේනර් එක ඇතුළට අයිස් පැක් එක දානවා අපි. දාලා මේකට අපිට දාන්න පුළුවන් තව සෙකන්ඩරි කන්ටේනර් එකක් මේක ඇතුළට දානවා ප්‍රමාණයෙන් කුඩා එකක්. ඒක ඇතුළට තමයි වෑල් එක දාන්නේ. එතකොට ඩිරෙක්ට් කන්ටැක්ට් වෙන්නේ අයිස් එක්ක අර තියෙන අපි දාන තියෙන පොඩි සෙකන්ඩරි කන්ටේනර් එක. ඒක ඇතුලේ තමයි වෑල් එක ඉන්නේ. එතකොට එයා ඩිරෙක්ට් කන්ටැක්ට් වෙන්නේ. එතකොට මේ හෝල් සිස්ටම් එකම අපි එක තැනින් වහනවා. එක තැනින් වැහුවාම මේක ඇතුලේ ඔක්කොගෙම ටෙම්පරේචර් එක මොකද්ද වෙන්නේ? එකක් වෙනවද නැද්ද ලෝ? ඕල්මෝස්ට් සාමාන්‍යයෙන් සිස්ටම් එකේම එකක් වෙනවා ඇතුලේ. අර ක්ලේ පොට් තියරියම තමයි ළමයි.
එතකොට සර් මේ සෙකන්ඩරි පැක් එක විදියට ගන්න මේ ඉටි බෑග් ඒ වගේ එකද සර්?
නෑ ඒ අපි ගොඩක් වෙලාවට ගන්න මේ මගේ හાર્ඩ් සර්ෆේස් එකක් තියෙන එකක්. සාමාන්‍ය දැන් අපි ඉතින් මේ මෙහෙම දැම්මත් එකයිනේ. අයිස් පැක් එකක් දාලා නිකන් ඉටි බෑග් එකකට දාලා දැම්මා සේම් වගේනේ. ඒක නිසා පොඩ්ඩක් මේ වගේ හાર્ඩ් සර්ෆේස් එකක් තියෙන එකක් දාන්න.
හරි සර් thank you සර්.
හරි. ඊළඟට ළමයි 1000 කීයද 1497 ඉන්නවද ළමයි 1497
Good evening, sir.
Good evening. Shall we start?
Yes, sir.
What is your name and where are you from?
I'm sorry, Steven, sir, from Kerala.
I don't hear clearly, Puta. So please speak loudly.
Yes.
Okay. Okay. Choose one prescription from this slide, Puta.
Okay.
Sorry, Puta. I don't get it. Actually, I don't hear well.
Prescription number 2.
Number 2. Okay. What do you think about prescription number 2?
We can dispense.
You mean you can dispense? What do you think about prescribed drugs and also the interactions that possible?
The lithium carbonate is a narrow therapeutic index, so we may interact with other drugs.
Which drugs in here?
It will level by diclofenac sodium. So
Sorry. Okay, tell me, can we prescribe olanzapine and haloperidol together?
no, sir. Both are psychotropics and in typical antipsychotic. So we can't prescribe in both in one prescription.
Your voice is not clear, Puta. It's just feel like you are speaking from far away from the device.
So,
now little bit okay, Puta. You can continue.
So the olanzapine and haloperidol are
typical antipsychotics, sir.
Mm-hmm.
So we can't prescribe in same prescription. It may give severe side effects like extrapyramidal syndrome.
Mm-hmm. What are the extrapyramidal symptoms that do you know?
Tardive dyskinesia,
Mm-hmm.
dystonia,
Mm-hmm.
Parkinsonism, PD, Parkinsonism disease, and yeah, that's it, sir.
Mm-hmm. Okay, what do you think about lithium and diclofenac sodium together in a same prescription?
Diclofenac sodium may induce the lithium plasma range in our blood.
Mm-hmm. Okay. What are the patient advices that you should mention when dispensing lithium carbonate?
Asked to follow up the prescription doses correctly and don't double the doses. Don't double the doses and check the blood count, check the liver function test and full blood count test frequently.
Mm-hmm.
That's it, sir.
Mm-hmm. What are the possible side effects that we are expecting with lithium carbonate?
Will give lithium toxicity, hepatotoxicity,
Mm-hmm. Only that.
and hyper sensitivity to light.
Mm-hmm. Okay. What is this product under emission number 4?
Metformin hydrochloride sustained release tablets, IP 500 milligrams.
Mm-hmm. What is metformin?
Metformin is a anti-diabetic drug, and that from bicarbonate class.
Mm-hmm. What are the common indications for metformin?
It will give to type 2 diabetes mellitus and gestational diabetes and some metabolic disorders also, like obesity.
Mm-hmm. Is obesity license indications for metformin use?
Yes, sir. I can't.
Is it license? I'm asking, when we are using metformin for
Not
obesity, is it license indication?
not licensable, but some it's a current now in current practice that also prescribed by some prescribers.
Mm-hmm. Okay. What are the side effects that we are expecting with metformin use?
It may cause abdominal discomfort, nausea, vomiting, abdominal pain, and, weight loss. That's it, sir.
Mm-hmm. Okay. Tell me, what are the patient advices you should mention when dispensing metformin?
Take the medicine according to the prescriber order and don't double the dose. If you miss the dose, take that dose as soon as possible. And after your after the food, after the taking lunch or anything, you take the medications. That's it, sir.
Mhm. Okay, tell me, what are the fast moving drugs available in your pharmacy? Tell me a few examples.
The omeprazole, paracetamol, ascorbic acid, vitamin C, Bico capsules, metformin, things, losartan.
Mhm. What are the slow moving drugs that available in your pharmacy?
Bisoprolol,
Mm-hmm.
clotrimazole, pessary, diclofenac suppositories, paracetamol suppositories.
Mm-hmm. Okay, those are slow moving. Okay, how do you handle expired pharmaceutical products or the drugs in your pharmacy? I mean, the expired.
Check the self thoroughly regularly about expiration date, and remove the expired products from the shelf and store in the designated shelf, and put a label as do not dispense. Those are expired products, and document those things in our expired books, and if able to return, contact the dispenser and tell about that one. If it can't return in front of the master pharmacist, discard those things. That's it, sir.
In front of the master pharmacist.
In front of the chief pharmacist.
What about the authorizers officers? Can we discard expired as we wish? We are over. We should discard expired under the direct supervision of authorizers officers. Authorizers officers are not chief pharmacists or the master pharmacist.
Food and Drug Inspector and provincial pharmacist.
Yes.
And NMRA authorities and district pharmacist.
Okay. How do you handle the quality failures or quality failure products in your pharmacy?
Maintain the regular checkups in our cells, and store the products according to first expire in first order, and store in the proper temperature for according to the same, and store in separate places for external and internal users. That's it.
Okay. What is a count appeal product?
Schedule 2B and Schedule 3 also. Schedule 2C and Schedule 3 are countable products like morphine,
No.
tramadol.
I'm not asking about countable, but I am asking about what are the counterfield medications? Counterfield.
Sorry, sir. I
Mm-hmm. Do you know about the fake products or the fake pharmaceutical? We call it as counterfeit products.
so,
Mm-hmm.
okay, sir.
Okay. Tell me, Puta, what are the physical characteristics that we observe when a drug or a pharmaceutical product not with their quality specifications?
Discoloration.
Mm-hmm.
Some sedimentation is there.
Mm-hmm.
And sticking the two tablets in same.
Mm-hmm. Okay, Puta, your time almost over. We'll see.
Thank you, sir.
ගොඩක් තැන් තියෙනවා හදාගන්න. patient advices ගොඩක් අමතකයි වගේ තියෙනවා struggle කරනවා කියලා පේනවා කතා කරද්දී. ඒ නිසා ගොඩක් practice කරන්න වෙයි පුතේ. සාමාන්‍ය අර ටිකක් boundary ඉන්නේ. තා පොඩ්ඩක් යහන මෙහාට වුණොත් අවුල් වෙනවා. ඒක නිසා ගොඩක් දේවල් හදාගන්න තියෙනවා. practice කරන්න.
Okay, sir. Thank you.
ඊවස්සේ හිතේ ඉන්නේ 312.
No, sir.
Shall we start with that?
Okay, sir. Good evening, sir.
Good evening, Pita. What is your name and where are you from, Pita?
Sir, my name is Tanuja. I'm from Gaul.
Mm-hmm. Okay, choose one prescription from this slide, Pita. I think we had taken prescription 2 already.
Prescription number 1.
Okay, what do you think about prescription number 1?
I think it's a genuine prescription, sir. But I don't know exactly metoclopramide dose frequency. As I remember, it may be TDS. In here, QID.
What about dose, Pita, in here? It is usual?
Dose, yeah, it's a high dose.
Your voice is breaking, but I think you have signal issue or something. Your voice is breaking.
10 milligram. Must be metoclopramide 10 milligram.
Your voice is breaking, but I think you have some kind of connection issue or something.
Now okay, sir?
Okay, now a little bit improved. Okay, you can continue with. Is she disconnected? No. Okay. Tell me about the dose of the metoclopramide. Disconnect another one. In Your time is going for the, I don't know. I think she is disconnected. She connected, no? Shall we continue with her? Can you hear me? Yes, brother. Can we continue?
So,
Still your voice is breaking. I don't know the issue.
so can you?
I think now it's
So there is a signal issue. Sorry.
it's, it's still same
So
issue.
can you hear me now?
Now okay.
Sir?
Okay, brother. Shall we continue? ළමයි ස්ලොට් එකෙද්දී කනෙක්ෂන් ඉෂුවස් නැති වෙන විදිහට තියාගන්න. එහෙම නම් ඔයාලට අපරාධයක්. chance එක. අපි
Sir,
තව
can you hear me now?
Okay, brother. Now fine.
Sir?
Yes.
Okay, sir.
Now fine.
Sorry, sir.
Okay. I think same issue going on, no? Okay, what do you think about the metoclopramide dose for the?
Now, okay, sir.
Mm-hmm.
It's must be 10 milligram, sir. In here, 20 milligram. I think it's high dose.
Mm-hmm. Okay.
Others are okay, sir.
You mean others are okay? What kind of a prescription is this for the? Can you guess the indications for this particular?
It's maybe, sir, Helicobacter pylori medication.
Mm-hmm. What
There
is Helicobacter pylori eradications? You are not audible with that. අපරාධතේ අපේ chance එක වගේ වෙලාව connection issues නැති වෙන්න තියාගන්න අනිත් දවසේ අපරාධය. ඇහෙන්න.
Sir, can you hear me now?
Now okay.
Helicobacter pylori, it's a bacteria. These three combination amoxicillin, clarithromycin, and omeprazole are used for this bacterial infections.
Mm-hmm. Okay. What is amoxicillin for the?
Amoxicillin is a penicillin, sir. Broad spectrum penicillin.
What are the other penicillins? Do you know?
Amoxicillin, cloxacillin, flucloxacillin, benzodiazepine, phenoxymethylpenicillin.
What are the common side effects that are associated with amoxicillin?
GI disturbances like nausea, vomiting, um, hypersensitivity reactions. It's and rashes, urticaria. Those are I can remember now, sir.
What is the third drug here? What is the third drug here?
Sir, can you tell the question again?
What is the third drug here, Buddha? Third drug. හරි කවන්න පුතේ අපි connection issues නැති වෙන දවසක try කරමු.
Sir, sorry, sir. I extremely sorry, sir.
හරි. දැන් ඕකේද පුතේ මාව ඇහෙනවද පුතාට පුතාව ඇහෙනවද?
What?
හරි. අපි තව එකපාරක්
No, sir.
අපි
Now
තව
I can hear,
එකපාරක්
sir.
try කරමු. What is the third drug here පුතේ?
Oh, okay. Omeprazole capsule, 20 milligram, sir.
What is the drug group?
Proton pump inhibitor, sir.
What are the other proton pump inhibitors do you know පුතේ?
Esomeprazole, pantoprazole, rabiprazole, lansoprazole.
Okay. What are the
Those are, sir.
okay, but what are the common indications for PPIs?
Esophageal reflux disease, dyspepsia, peptic ulcers, yeah, those are, sir.
Okay. How do you advise for a patient when dispensing omeprazole like proton pump inhibitor?
Yeah, sir. Omeprazole, I would tell the patient omeprazole is should taken at least 30 minutes before meals and twice daily. And do not exceed the dose and omeprazole. And do not miss the dose because omeprazole is very important for reduce the side effects of other drugs like clarithromycin. So omeprazole should be taken regularly as prescribed.
What is the purpose of omeprazole in Helicobacter pylori eradication regimen? Is it for the side effect or the any other reason?
Actually, I can't remember it, sir.
We are adding PPIs to accelerate the ulcer healing rate, Putha, not for the side effect. No?
Oh, okay, sir.
Mm.
Actually, I didn't know about it. Sorry.
Okay, Putha. Then I am moving for a product. What is this product under image number 2?
Mm, Image number 2. Chloramphenicol eardrop, sir. 5%.
Mm-hmm. What is the drug group?
Chloramphenicol. um, Drugs used for eye infections. Uh,
Drug group.
I can't remember, sir, now.
It is antibiotic, Putha. So, is there any particular group of chloramphenicol?
Sorry, sir. Yeah. Chloramphenicol.
Yeah, generally categorized as miscellaneous. No? Okay. Tell me
Yes,
patient advices for this particular dosage form. This one.
Uh, Eardrop. When I would tell the patient, before use the eye drop, wash your hands and dry, and then remove the cap of the eye drop, and
This is not an eye drop, Putha. This is a eardrop. Eardrop.
sorry, sir, eardrop. Then remove the cap and like lay down as you comfortable. Then add required drops to the ear canal, and do not touch the tip of the eardrop, and wait at least 5 minutes to when wait at least 5 minutes. Do not stand up positions. Then when you use the other ear, repeat the procedure.
Okay. I am describing a particular scenario in a community pharmacy. Putha. There is a
Okay, sir.
There is a patient came to our pharmacy. She is asking for emergency oral contraceptive pills. But she seems like around 16 years old. Can you sorry, do you dispense or not for the particular patient request?
Emergency contraceptive pills can dispense, sir, because it's a schedule 1 drug, Postino brand. But patient around 16 years old, there is some complicated factors. I should ask some questions with her about her age, and advise her to the side effects of this product, because she's a young girl. It's affect her future directly. Then I patient and should advise her to prevent these incidents again, because and I dispense because she is on emergency situation. Mm,
Mhm. You are dispensing.
uh, uh, yes, sir. Because as ethical pharmacist, I think about my patient because she is very young girl, and it's directly affect her future and her life. So
Mhm.
I dispense is it, but and I strictly advise her uh, about this uh, product uh, and prevent these incidents.
Okay, very good. Okay, then tell me what are the contraceptive products that available in your pharmacy, like emergency contraceptive fields?
Uh, Postino 1 and 2,
Mhm.
Mituri,
Mhm.
uh, um, Yasmin, uh, uh, Femina, uh, yes, Dine 34, uh, like so.
Mhm. Okay, what are the patient advices that you should mention when dispensing a product like Postino 2?
Uh, Actually, Postino 2 is emergency contraceptive. Don't use it again and again. I mean, usually some patients use it as a regular oral contraceptive method. Like so, I would tell them to don't use it regularly. And Postino 2 is should used within 72 hours for get maximum effectiveness of the drug. First tablet should take as immediately the after the sexual intercourse, and the second tablet should be taken within 72 hours. Uh, do not miss the pills, uh, and uh, and I should advise do not use it as a usual method.
Mhm. Okay, Mita. Your time almost over. මන්දන කනෙක්ෂන් ඉශ්ුව එක නිසාද කියලා සමහර
Oh,
අපහට තැන් තිබ ඒ නිසා හදාගන්න එනවා පේෂන් ඇඩ්වයිස් ඇති පොඩ්ඩක් ලැක්වෙන තැන් තියෙනවා
yes, sir.
තියටිකල් බේසක නම් ක්ලිය කියලා තේරනවා ටික කතා කරද්දි එකට සමහරයව හදාගන්න තියෙන කනේෂන් ඉශ්ුව එක නිසා දන්න සමහරයව මට ඇහෙනීමනේ අපි
Oh,
බලඒකෙත් එක්ක මේක ටික අඩුපාඩු තියෙනවා ටික හදාගමු
okay, sir. Thank you, sir.
හරි ඊළඟට ළමයි 1904
Oh, sir.
shall we start with that?
Okay, sir.
Okay, what is your name and where are you from, Putha?
I'm Dasini Vijay Singh from Kadutare.
Okay, what is your pharmacy, Putha?
Isuru Pharmacy, Kadutare.
Mhm. Okay, you can choose one prescription from this slide.
Mhm. Number 1.
Mhm. What do you think about prescription number 1?
It can be dispensed.
You mean you can dispense?
Yes, sir.
Mhm. What about the prescribing?
No, sir. Actually, there is polypharmacy.
What is the
Uh,
polypharmacy condition here?
glycoside, glibenclamide tablets are in the same drug group.
What happen when we use same group drugs?
It may be worsen the side effects.
Okay. Is there any other deficiency rather than this one?
Using glycoside, metformin also does the same thing for the patient.
Okay. What is the fifth drug here?
Rapaglinide tablet, 2 milligrams.
Are you compatible with the dose here, 2 milligram TDs?
I'm not sure about that, sir.
Okay. What is the drug group for this drug?
Actually, I can't remember.
Okay. What is the third drug here, Buddha?
Sitagliptin tablet.
What is the drug group for sitagliptin?
Oh, sir, I can't remember.
Then tell me, what are the possible side effects that we are expecting with sitagliptin-like drug? What are the side effects, Buddha? Possible side effects? Okay, then tell me about metformin, Buddha.
Metformin is a gluconide. It's used for type 2 diabetes.
Okay. What are the side effects that we are expecting with metformin use?
It may cause weight loss, gastric irritations, and lactic acidosis. Likewise.
Okay. What do you think about this prescription under prescription number 2?
It can't be dispensed because the prescriber's signature is missing.
Any other deficiency rather than the signature issue?
I can't find anything.
What do you think about the co-amoxicillin and durations of prescribing, and also the prednisolone dose and the duration of prescribing?
Corticosteroid cannot be dispensed that much time because it is an antibiotic. Prednisolone also cannot be dispensed in the same dose. It should be tailed off.
Okay, what is the second drug here?
Fexofenadine tablet.
What is the drug group that fexofenadine belong to?
I think NSAID.
Sorry, Pita.
NSAIDs.
Are you sure? Is
Yeah.
fexofenadine belong to NSAIDs?
I'm not sure about that.
What about the antihistamines?
Mhm.
Tell me few examples for antihistamines that do you know?
Montelukast, cetirizine, chlorpheniramine.
Is montelukast belong to antihistamines?
Bronchodilators.
Montelukast is a leukotriene receptor antagonist, not antihistamines. It has kind of antihistamine properties, but we don't classify it. Okay. Okay, then I'm moving it. Product-based questions. What is this product on the image number 2?
Wormox 500 milligram tablets.
What is the drug inside the Wormox? Wormox is the brand name.
Mebendazole 500 milligram.
What is the drug schedule for mebendazole? This particular brand, Wormox. Drug schedule.
Schedule 2A.
2A.
A. Yes.
Okay. What are the advices that you should mention when dispensing this mebendazole?
Take the whole tablet. Don't chew or crush. When someone is taking Wormox, it should take all the members in the house at once. That's it.
Okay. Tell me, what are the solid dosage forms that available in your pharmacy?
Tablets, capsules, powder for suspension.
Tell me few examples for that tablets that available in your pharmacy.
Paracetamol, Digene tablets, Wormox, chlorpheniramine, salbutamol.
Okay, tell me what are the modified release dosage form available in your pharmacy?
Omeprazole, sorry, metformin tablets.
I'm not asking about the example, but I am asking about what are the modified release dosage form types available in your pharmacy.
Okay, so tablets.
What kind of tablets? There are several categorizations in modified release.
SR tablets, XR tablets.
What is meaning by SR?
Sustained release tablets.
Okay. What are the other modified release tablets available in your pharmacy?
Extended release tablets. XR also mean the same.
Any other? What about the enteric-coated or the delayed release tablets? Is it developed?
Enteric-coated tablets are available. I don't think it is like SR tablets.
Okay, tell me few.
Enteric-coated tablets are released. Sorry?
Okay, but you can continue.
Enteric-coated tablets are released in the intestine. That's why I said so.
Tell me few examples for enteric-coated tablets that available in your farms.
Esomeprazole tablets, aspirin, diclofenac, rabeprazole, pantoprazole.
What is the main difference between a sustained release tablet and a enteric-coated tablet?
Sustained release tablet always maintain a particular dose in the bloodstream. Enteric-coated tablets are designed to skip the stomach because those medicine may be degraded with the acidic condition in the stomach. They are not intended to really, maintain a particular concentration in the bloodstream.
Okay, tell me what are the patient advices that you should mention when dispensing a enteric-coated tablet?
Do not crush, cut, or chew tablets. Do not take with antacids. That's it, sir.
Any other specific advices?
I can't remember, sir.
Okay. What are the advices that you should mention when dispensing a sustained release tablet?
Do not double the dose. Always take the dose as mentioned. Do not crush, chew the tablet. Take with plenty of water. That's it.
Okay. Tell me, how do you manage the drug storage inside your pharmacy?
Sorry, sir.
How do you manage the storage of your pharmaceutical inside your pharmacy?
We store drugs in FIFO system, first expiry, first out, and also we store creams, ointments in separate racks, and tablets and fast moving tablets in a separate shelf. According to the temperature, the storage conditions, keep the medicine that should be the medicine that are mentioned to be stored in the refrigerator are stored in relevant areas of the refrigerator, and other medicines that should be protect from light and heat, they are in a separate shelf which protect from light and heat. Maintain the correct temperature according to the mention manufacturer mentions. And also syrup and reconstitution powders are stored in a separate area.
Okay, පුතා, your time almost over. අපි බලමු. පුතාගේ සමහර ඒවා මතක නැහැ කියලා තේරෙනවා. තව ඇඩ්වයිසස් ගද්දි තිරවෙන තැන් තියෙනවා. ක්ලාසිෆිකේෂන්ස් ටික අනිවාර්යෙන් බලන්න ඩ්‍රග්ස් වල. සිම්පල් ඒවත් වරද්දනවා. ඒ ටික බලන්න. අපි බලමු ඉස්සරහට ප්‍රැක්ටිස් කරද්දී ඉම්ප්‍රූව් වෙයි. ටිකක් නේ ගොඩක් හදාගන්න දේවල් තියෙනවා. අපි බලමු ඉස්සරහට.
Thank you.
ඊට පස්සේ 1289 ලා.
Good evening, sir.
Good evening, Pata. Shall we start?
Okay, sir. We'll start.
Okay. What is your name and where are you from, Pata?
I'm Vasana Rajapaksha. I'm from Colombo.
What is your pharmacy, Pata?
My pharmacy is Rockham Pharmacy, Malabar.
Who is your master pharmacist?
He's Mr. Sharon Patirana.
Okay. You can choose one prescription from this slide, Pata, as you wish.
I'll take the second one, sir. Second prescription.
Okay. What do you think about second prescription?
Actually, in the prescription, the doctor details, the patient details, the date is wrong. It's overdated. So because of that, the doctor details and the patient details are okay, but they overdated. So I can't give this prescription.
Rather than the issue with the date, is there any other issue?
Ibuprofen 400 milligram we can dispense BD. Azithromycin is an antibiotic. It's the dose also correct. It's prescribed for once daily. And the two antibiotics are prescribed. So I consider this as a error in the prescription, sir. Deficiency.
Okay. We can take as irrational combinations, kind of.
Yes. Yes.
But there is a specific note in the prescription. Prescription say diagnosis is viral pharyngitis. So these antibiotics, is they are necessary for this patient?
No, actually, azithromycin and coamoxiclav is antibiotics. So for viral condition, I think it's not appropriate, the antibiotics. We need antiviral drugs for viral.
Okay. But what is azithromycin input?
It's a antibiotic. It's a macrolide antibiotic.
What are the other macrolides? Do you know?
Clarithromycin.
What are the possible indications for azithromycin?
It's for upper respiratory tract infections, mostly used.
Any other indication?
Azithromycin, bronchial infections also.
Okay.
And also, yes. Yes, sir.
Yes, you can continue.
And also I have noticed that azithromycin has been prescribed for acne also for some prescribers.
Mhm. Kind of. Okay. What are the possible side effects that associated with azithromycin use?
Azithromycin, GI disturbances, rashes. That's all I remember, sir.
What is the third drug here?
Citrazine tablet, 10 milligram.
What is the drug
Citrazine.
group? Okay, but what is the drug group?
It's antihistamine, second generation antihistamine.
What are the other?
Non-sedative.
Okay, what are the other second generations non-sedative antihistamines? Do we know?
Fexofenadine, citrazine, fexofenadine, loratadine, and desloratadine.
What are the first generations sedative ones that do you know?
Chlorpheniramine, promethazine, chlorpheniramine, pheniramine, cinnarizine. I can't remember all.
Okay, what are the specific patient advices that you should mention when dispensing antihistamines like drugs?
Antihistamines, yes. Antihistamines, especially when the sedative antihistamines, first generation, the sedation, drowsiness become. So I advise the patient to avoid when taking the drugs, avoid the machinery handling, like those tasks, and driving, to avoid those things. And I make them aware that it's the sedation comes from this drug.
Okay. Okay, then. What do you think about this prescription number 2? This one.
Yes. The date, doctor details, and the patient details are okay. So I consider this as a genuine prescription. When considering the drugs prescribed, it's amitriptyline and duloxetine capsules are for those are psychotropic drugs for like depression, for depression. Neurobion is as a supplement, vitamin B. Tramadol, it's a painkiller. Opioid painkiller.
So are these drugs are compatible with each other?
Duloxetine and amitriptyline do not compatible.
What do you think about tramadol?
Tramadol. Yes, it also doesn't compatible with the above two drugs, as it's a opioid. So side effects may be increased when combine these three drugs.
What do you know about the serotonin syndrome?
Yeah, serotonin syndrome means this when taking this combinations of psychotropic drugs, this serotonin syndrome comes.
So there is a possibility in this prescription.
Yes.
Okay. What do you think about amitriptyline dose here? It is 2.5.
Mm.
Is it enough for this
It's
patient?
no, he's a 42-year male, so the dose is low dose
Mhm. Okay.
for adult.
Okay, brother. Then I am moving with the product-based question. What is this product under image number 1?
So, it's a dry powder, the metered dose inhaler, salmeterol and fluticasone inhaler.
Okay.
Metered dose inhaler.
Okay. How many doses are available with this particular MDA?
120 doses.
How do you advise for a patient regarding the recognizing of available doses of this MDA?
There is an indicator in the metered dose inhaler. I'll show you the how to check the metering valve. So then he can notify the how many meter doses are available, and when it is over, he can notify that when all the doses are over.
Okay. What are the other essential patient advices that you should mention when dispensing this kind of a MDI?
So yes, you mean the how to use that the directions you asking, sir?
Yes, but patient advice.
Yes. Yes. So first of all, when you before using this, you have to wash your hand with soap and clean your hands. Then take out the MDI and shake it well. Shake it and remove the cap and keep upright side the inhaler and between teeth hold the mouthpiece. Sorry, before that you have to exhale out the empty your lungs and then close the keep closer the MDI between your teeth and close the seal with lips. Then press the canister and get a deep breath and hold the breath for 10 seconds and remove away the MDI and breathe out. If you need another puff, wait about 10 seconds and do as the earlier method. And also after using this tongue, since it is a corticosteroid, you have to rinse your mouth and put the water out.
Okay, very good. Okay, tell me, Puta, what is a borderline product?
Borderline product is yes, it contains the characteristics of medicine and a cosmetic, and medicine and a food, medicine and a device. The combined characteristics are there. The borderline can be a medicine, characteristic contain medicine and a medical device, medicine and a food, medicine and a cosmetic.
What are the borderline products that available in your pharmacy?
There are milk powders like Sustagen. Those included, there is a medicinal value also as a food. And there are some toothpastes also containing some medicinal value and also a cosmetic value. And there are some creams also containing used as a cosmetic, also as a medicine. Medicinal value is there.
Okay, Puta. Do you know the schedules of the borderline products as per the NMRA classification?
For borderline products, actually, sir, I'm not aware, sir, about that. I know only about there are group according to the medical devices as differentiate into classification, and also medicines. Borderline products, I am not aware, sir.
They
Borderline
also has the
products.
classifications. Okay, it's okay. We are moving with another one. Okay. What are the patient advices that you should mention when dispensing a product like a borderline product?
Borderline product. I'll be looking at the manufacture instructions, and I'll advise the patient accordingly.
Very good. Okay, your time almost over, Puta. සමහර තැන් හොඳයි. සමහර තැන් තියෙනවා හදා ගන්න ඕනේ පොඩි හිර වෙන ලැග් වෙන answers එන්නේදී තැන් තියෙනවා. ඒ ටිකත් හදාගමු. Almost සමහර ඒවා clearly defend කරනවා ඒක හොඳයි. සමහර ඒවා චූටි තියෙනවා හදා ගන්න අපි බලමු ඉස්සරහ training කරනකොට හරියයි.
Thank you, sir.
හරි. ඊට පස්සේ 1116 පුතේ. නූහනේ.
Oh, sir.
Oh, shall we start?
Okay, sir.
Okay, Buddha. I will change the order, okay? So there will be no prescription for you. What is this product, Buddha? Under image number 2.
The diclofenac gel.
This one, Buddha. Under image number 2.
Okay. Doxycycline capsule 100 milligram.
What is doxycycline, Buddha?
It's a tetracycline group of antibiotic.
What are the other tetracyclines? Do you know?
I know other than doxycycline, tetracycline.
Is this available in your farms?
Yes, sir.
Is it fast moving, Buddha?
No, sir. It's slow moving.
Okay. What are the common indications for doxycycline?
Commonly indicated for acne vulgaris treatment. That only I remember now.
Only that. Okay then. What are the possible side effects that we are expecting with doxycycline?
Yeah, it commonly causes GI disturbance like nausea, vomiting, and also abdominal pain. And it can cause drowsiness and
පුතේ voice එක break වෙනවා signal issue එකක් තියෙනවා. හරි. Tell me what are the patient advices that you should mention when dispensing doxycycline? You are not audible, Buddha. Still not audible, Buddha. තමයි කනෙක්ෂන් ඉෂුස් තියෙනවා නම් ස්ලොට් එක එන වෙලාවට සිග්නල් තියෙන තැනකට ගිහිල්ලා හරි කරන්න අපරාධ නැත්තම් ඔයාලගේ.
So can you hear me?
Now okay පුතා. I was asking what are the patient advices for doxycycline?
Yeah, it commonly causes GI side effects. So we have to take after meals, and also it should be taken with full glass of water, and do not exceed the doses. And if symptoms side effects develop, should be continue the full regimen. That's enough.
What is this product puta under image number?
It's a combined oral contraceptive pill contain levonorgestrel and ethinyl estradiol.
Okay, what are the APIs?
Levonorgestrel and ethinyl estradiol.
What are the common indications for this particular product?
It is commonly used for contraception.
Describe the packages puta.
Primary packages aluminium and plastic blister pack or calendar pack, and secondary packages cardboard carton box.
Okay, what are the advantages of this calendar type pack?
It is improve the patient compliance and rational use. So the patient can follow the arrow mark that behind the blister, and it is compatible to use the full regimen.
Tell me patient advices for this particular product.
Yeah, it's better to take between 1 to 5 days of menstrual cycle, and it's recommended to first day, and also it should be take the same time each day, and it's preferable at night because to easily remember, and also should be follow the arrow mark behind the blister pack, and if it is bleeding during the regimen, it is not a harmful side effect, should be continue the dose, and after complete the first blister, should be continue the another blister continuously, and that's enough.
What is your advice if patient miss one dose?
If miss one dose, if take as remember as possible. If it is come to next dose, it's okay to take double the next dose. But if miss more than one dose, take additional contraception like condom use or an emergency contraception.
What are the possible side effects that we are expecting with use of this product?
In possible side effect like VA discomforts can occur, and also galactorrhea, restlessness, and osteoporosis, weight gain, unusual hair growth may happen.
Okay. What is this device under image number 3?
It's a aerosol spacer.
How do we use this particular device?
It commonly used with meter dose inhaler to compatible the dose administration.
What are the advantages of this spacer device?
It commonly used in pediatric patients under 5 years because they cannot maintain the breath and hand breath coordination. So that's why it can compatible the doses without coordination. And also it reduces the deposition of the drug under the mouth. That's why.
Okay. How do you advise for a patient regarding cleaning of this device?
Yeah, it commonly clean twice because it's under the usage of thrice. If the patient use thrice daily or twice daily, whatever it is, it's commonly cleaned twice weekly. It should be um, put into some water and soapy water, and then allow for 10 minutes, and after that it should be cleaned with running water and air dry. That's enough.
Okay.
Do not wipe with any clothes.
Okay, tell me, Puta, what are the other specific patient advices that you should mention when dispensing this device?
It should be correctly attached to the mouthpiece of the meter dose inhaler, and that technique should be advised to patient, and also cleaning technique should be advised to patient. Other than that, it should be keep dry in cool place. That should be advised to patient.
Okay. Is this device available in your pharmacy?
Yes, sir.
Okay. Tell me about inventory control in your pharmacy or the inventory management.
Yeah, we have to manage our inventory about the under the slow moving and fast moving drug wise. If we consider the slow moving drugs, we are ordering in very low level and long as far. But in fast moving medications, now we can ordering twice monthly likewise. And also it is maintained by expiry of the medications and their usage likewise. And also we have to maintain non-moving medications, shouldn't order any continuously, and avoid expiry products by maintaining an expiry medication book, and likewise we have to manage the inventory.
Okay. Okay, tell me, Puta, what is a buffer stock?
Buffer stock. We have to reserve some fast-moving drugs as buffer stock. It means we have to store the stock extra. It's called buffer stock also.
Okay. Tell me or describe what you're going to do when your vendor came to your pharmacy to hand over a stock that you already ordered.
Okay. So firstly, we have to identify the vendor, and then we have to make the product.
ආයෙ හෙන්න නැතුව ගියා පුතේ. ඇහෙන්නේ පුතේ.
Can you hear me now?
Now fine පුතේ.
Okay. After check the invoices and product, we have to receive the product and we have to store another area. And after GRN, goods receive note, and then update the good receive note to the software and then arrange to the dispensing area. Like first expiry, first out wise.
Okay පුතේ. Your time almost over. We'll see. අර පොඩි අඩුපාඩු තියෙනවා. ලැග් වෙන තැන් තියෙනවා. ඉස්සර ගිය ගමනට තරම් ඇවිල්ලා නැහැ තාම පුතේ. ගිය ගමන ඊට වඩා හොඳට perform කරානේ නේ. වයිවා කොහොමද තිබ්බේ පුතේ ගිය ගමන?
B sir.
මේ තිබ්බේනේ. ඒක නිසා තා පොඩ්ඩක් හදාගමු. එතකොට අපිට තා පොඩ්ඩක් ලකුණු අප් කරගන්න පුළුවන්. ඒක chance එකක්. එතකොට final marks හදාගන්න. තා පොඩ්ඩක් හදාගමු.
සර් මට එයාලා prescription ඇහුවා මෙහෙමයි. prescription මට දුන්නා. එයාලා ඇහුවා අපි ඔයාගේ customer you dispense this prescription like this. එහෙම තමයි එයාලා ඇහුවා.
ඔයාගේ customer ලියලා තියෙන විදිහට ඔයා dispense කරනවද කියලා ඇහුවේ.
නෑ prescription මට දුන්නා. ඊට පස්සේ කිව්වා හරි අපි customer ඔයා dispense කරන්න කියලා කිව්වා.
එතකොට
ඒක එතන කියනවා prescription වල. ඒක මම බලලා කියන්න ඕනේ. මම first time understand කරන්නේ යාලා කොහොමද කියන්නේ මොකද කියන්නේ කියලා. එහෙම කියන්නේ නෑ මේ කොමන්ලි. ඒ හින්දා.
මේකනේ ඒගොල්ලෝ try කරන්න නැත්තේ පුතේ scenario එක base කරන්න. ඒ කියන්නේ customer pharmacist introduction එකක්. දැන් අපි මෙහෙමනේ exam එකකදී නම් examiner ඇහුවොත් මේක දෙන්න පුළුවන් බැරිද කියලා අපිට justify කරන්න පුළුවන්. ඒතකොට customer කෙනෙකුට ඒක response කරනකොට අපි ඊට වඩා වෙනස් වෙන්න ඕන. දැන් customer කෙනෙකුට මෙතන drug interaction එක අපි පැහැදිලි කරන විදිහයි examiner කෙනෙකුට පැහැදිලි කරන විදිහයි වෙනස්නේ. customerට අපි කියන ඒවා තේරෙන්නේ නැහැ. එතකොට එයාට lay language එකකින් තේරෙන විදිහට කියන්න ඕන. එතකොට පොඩ්ඩක් ඉතින් ඔළුව කල්පනා කරලා එතන adapt වෙන්න ඕන අපි. එහෙම වෙන්නේ නැති පුතා කියන එක අනුව මට තේරෙන්නේ එහෙමයි. ඒ කියන්නේ එයාගොල්ලෝ එක්ස්පෙක්ට් කරන්නේ ඔයා කොහොමද කස්ටමර්ට රෙස්පොන්ස් කරන්න කියන එක එයාගොල්ලන්ට රෙස්පොන්ස් කරලා පෙන්නන්න කියලා. එතකොට ඔය ප්‍රෙස්ක්‍රිප්ෂන් එකේ තියෙන ප්‍රශ්න අපි පැහැදිලි කරද්දී කස්ටමර් කෙනෙක් එක්ක බිහේව් වෙන විදිහට පැහැදිලි කරගන්න වෙනවා. පැහැදිලි කරන්න වෙනවා. ඒක තමයි එතකොට ඒගොල්ලෝ රික්වෙස්ට් එක්ස්පෙක්ට් කරන්නේ. ඒ වගේ වෙන්න පුළුවන් ළමයි. ඉතින් එකම questions pattern එකම හයි කියලා අපිට හිතන්න බෑ. ඒගොල්ලෝ change වෙනවා. ඒගොල්ලන්ටත් මේක ළමයි බර ගානක් වයිව කරනකොට කම්මැලිනේ. ඒකෝර ඒගොල්ලෝ සමහර ඒවා change කරනවා. ඒ අනුව ඉතින් අර තමන්ගේ critical thinking එක තමයි හැදෙන්න ඕන. ඒ අනුව තමන් response එක හදාගන්න. තමයි group එකේ දාලා තිනවා මේ Zoom එක disconnect වෙනවා කියලා. ඒ issue එකක් තියෙනවා අනිත් අයට. දැන් auto
සර් මට prescription අහන්න බැරිද?
අහන්න පුතේ අහන්න. prescription එක අහන්න බැරිද කියලා අහන්නේ.
ඔව් සර්.
අහන්න prescription අහන්න තා practice කරනවනේ අහන්න. මම අර එක දිගටම ගිය නිසා prescription ඇහුවේ නැත්තේ. අපි practice කරමු පුතේ අවුලන්නේ. ගොඩක් prescription හම්බෙයි අපි exam කරනවානේ එල්ලවන්නේ. සහ මම අරට පරණ රෙකෝඩින් ඔක්කොම දෙන්නම් වෙලා තියෙනවා නම් බලන්න. එහෙම අර prescription ඔව්ද
එතකොට සර් ඩ්‍රග් ඉන්ට්‍රැක්ෂන් එකක් එහෙම තියෙනවා නම් patient කෙනෙක්ට ඒක කොහොමද තේරුම් කරලා දෙන්නේ ඒක
එතකොට අපි
ඒ භාෂාවෙන්
patient response කරන විදිහ examinerට පෙන්නන්න ඕනේ. එතකොට අපි patient ඉස්සෙල්ලා calm down කරලා කියන්න ඕන මේ prescription එකේ මට තේරෙන විදිහට බෙහෙත් දෙකක් අතර පොඩි අන්තර්ක්‍රියාවක් තියෙනවා. ඒක පොඩ්ඩක් serious එකක්. ඒ නිසා prescribe එක discuss කරලා ඒක verify කරගන්නකම් ඔයා චුට්ටක් ඉන්න කියලා. එතකොට ඒ වගේ අර අපි natural behavior එක එතන පෙන්වන්න ඕනේ. එතකොට shape ලම. ඒක තමයි ඒ වගේ ඒගොල්ලෝ expect කරොත් බලන්නේ. ඒක අර අපි hospital එහෙම ඒ වගේ answers ලියවිලම ඒ වගේ තමයි එතකොට handle කරගන්න වෙන්නේ. මම ඉස්සෙල්ලා කියන්න try කර හිටියේ ප්‍රෙස්ක්‍රිප්ෂන් බේස් වෙලාම ක්වෙස්චන්ස් අහයි කියලා හිතාගෙන යන්න එපා ළමයි. ප්‍රෙස්ක්‍රිප්ෂන්ස් නැතුව ওই විදිහට ප්‍රොඩක්ට් ඩිවයිසස් බේස් කරලා විතරක්ම අහලා තියෙනවා. ඔය මොනවත්ම නැතුව ඩිරෙක්ට්ලිම ඔය මං අහනවා වගේ ෆාමසි ප්‍රැක්ටිස් එකේ එක්ස්පයර් කොහොමද හැන්ඩල් කරන්නේ. ඒ වගේ ඩිරෙක්ට් ක්වෙස්චන්ස් අහලා ඒවල ඒව අයත් ඉන්නවා. ප්‍රොඩක්ට් එකක් තියා ප්‍රෙස්ක්‍රිප්ෂන් එකක්වත් දැකලවත් නැතුව පේස් කරලා ඇවිල්ලා ළමයි ඉන්නවා. ඔබාන්ට එක්ස්පීරියන්ස් තියෙන අය ප්‍රෙස්ක්‍රිප්ෂන් නැතුව ප්‍රශ්න ආපු අය ඉන්නවද ළමයි? ගිය ගමන් පේස් කරපේ කවුරුවත් ඉන්නවද? කවුරුත් නැද්ද? ඒක නිසා හැම වෙලේම ප්‍රෙස්ක්‍රිප්ෂන් වලින් අහයි එහෙම හිතාගෙන යන්න එපා. සහ ප්‍රොඩක්ට් වලින් විතරක් අහයි කියලා යන්න එපා. දෙකම මික්ස් හෝ නැති වෙන්නත් පුළුවන්. ප්‍රශ්න chat session එකේ තියෙනවා නම් කීපයක් බලන්න. අය පොලිෆාමසි තියෙනවා ප්‍රැක්ටිස් කරමු පුතේ. හරි. තව ඉස්සරහට තියෙනවනේ කොට. So borderline product doctor advice. Borderline product වල categorization එකක් තියෙනවා පුතේ. prescription ඕන ඒවා තියෙනවා. prescription ඕන නැති ඒවා තියෙනවා. ඒතකොට prescription ඕන එකකට නම් ගොඩක් වෙලාවට ડોක්ටර් කෙනෙක්ගේ recommendations ඕන. හරි. ඊළඟට ළමයි 35. කවුද අපේ? 35 ළමයි. නැද්ද? 35. නැද්ද ළමයි? ඕගොල්ලෝ ස්ලොට් එක ලොස් කරගන්න එපා ළමයි අපරාධයක් ඒක. 0.35. හරි. එයා නැත්තම් අපි ඊළඟ ස්ලොට් එකට යනකම් බ්‍රේක් එකක් ගන්න ළමයි. ඊළඟ කතා කරන්නේ 10 මිනිත් විතර බ්‍රේක් එකක් අරන් ඉන්න. ඊළඟට ඉන්නේ 887. ලෑස්තිලා ඉන්න අපි 10 මාර්ච් විතර පටන් ගමු. බ්‍රේක් එකක් අරන් ඉන්න ළමයි. another slot හෙට දානවා. හැබැයි ෆස්ට් රවුන්ඩ් එකේදී අද පේස් කරපේට හෙට chance එක නෑ ළමයි. එතකොට ආයේ ඔක්කොම කම්ප්ලීට් වුණාට පස්සේ තමයි ඊළඟ ඔයාලට ආයෙන්නේ සෙකන්ඩ් රවුන්ඩ් එකේ තමයි ඊළඟ ඔපචුනිටි එක එන්නේ. 60ම කව කරන්න එපාම. නැත්තම් මට බර ගානක් දාගෙන කරන්න දෙමුණා කැමති අය කරන්න කැමති අය නිකන් ඉන්න කියලා. එහෙම කළා තේරුම් නැහැ. ප්‍රශ්න අහනවා then මේ give prescription will they give written or printed ගිය ගමන වයිබ් එකට written ඒවා දීලා තිබ්බා අතින් ලියපුවා දීලා ඔස්පීකර printed ඒවා දීලා තිබුණා ඒක නිසා දෙකටම හුරු වෙලා යන්න අතින් ලියපුවක් දෙන්න හරි බ්‍රේක් එක අරන් ඉන්න ළමයි අපි 10:30ට පටන් ගමු හරි ළමයි කට්ටියම ජොයින් වෙන්න ඇති කියලා හිතනවා චුට්ට වෙලක් ගිහින් පටන් ගන්න ප්‍රශ්නයක් අහලා තියෙන පොලිෆාමසි ගැන කියන එක හරි මම අතරතුර chance එකක් හම්බෙච්ච එක කියන්නම් පුතේ පොලිෆාමසි ගැන හෝ ප්‍රෙස්ක්‍රිප්ෂන් එක හම්බුනම පැහැදිලි කරන්න ඊළඟට හින්කියේ විදියට අටසිය අසූ හත පුතේ ඉන්නවා
Yes, sir.
shall we start පුතා
Okay, sir. Good evening, sir.
good evening today what is your name and where are you from පුතා
I'm Nimesha and I'm from Goa, sir.
okay what is your pharmacy පුතා
At present, I'm working at Sakura Pharmacy Code.
who is your master pharmacist
My master pharmacist is Mrs. Kayani Indika.
okay you can choose one prescription from this slide puta, as you wish
Okay, sir. I'll go with prescription number 2.
what do you think about prescription number 2
I think this is not a genuine prescription, so I can't dispense this.
why explain the reasons
Because I have found a polypharmacy condition here. Both etracoxib and diclofenac sodium has been prescribed here.
any other issues
And also, diclofenac dose is not usual. It's 100 milligram dose is not typically given as BD dose. It's usually given as once daily treatment, sir.
okay puta. What is the main difference between etracoxib and diclofenac here as in NSAIDs
Etracoxib is a selective COX inhibitor, and diclofenac is non-selective COX inhibitor.
what is the main difference between these two
Sorry, sir, I can't understand it.
what is the main difference between these two drugs as NSAID there is a difference between these two no I'm asking about what is the difference
Yes, sir. Etracoxib is a selective COX inhibitor. It inhibits COX enzymes selectively, and diclofenac is a non-selective one.
okay which drug has much potential to cause gastric side effect otherwise gastrointestinal complications
Diclofenac has the most potential, sir.
okay what are the common indications for diclofenac like NSAIDs
It's commonly given to relieve the inflammatory conditions and also to treat joint pains, backache, headache, like those conditions, sir.
what is the third drug here
It's a paracetamol tablet, sir.
how do you advise for this particular patient regarding the paracetamol use
You have to take 2 tablets when necessary. I mean, when you occur a pain, and do not exceed the maximum daily dose 4 gram, and you have to take it with a minimum time interval for about 6 hours, and do not exceed the recommended daily dose. So likewise, I will instruct the patient.
Okay. What are the possible side effects that we are expecting with paracetamol use?
It may cause hypersensitive reactions sometimes, more rarely, like rashes, and also if it used for long term, it may cause renal impairment, and also if overdose, it may cause hepatotoxicity, sir.
Okay. What do you think about prescription number 3?
I think it's a genuine prescription, sir.
This is genuine under prescription number 3.
Yes, sir.
What about the patient conditions and the prescribed drugs? Are they appropriate for the patient condition?
Sorry, sir, I can't recognize it.
This patient is pregnant late. So, what do you think about the drugs?
Okay, sir. Warfarin is not typically given in pregnancy, so caution should be practiced when dispensing this.
Only warfarin.
No, sir. Hydrochlorothiazide also. And telmisartan is also there, sir. All
All
3 drugs.
methyl dopa
Yeah.
the recommended drug. Other all are some kind of risk carrying. Okay.
Yes, sir.
Tell me about warfarin.
Warfarin is an anticoagulant drug, so it's given for the treatment of thromboembolic conditions, and also in prophylaxis of insertion of prosthetic valves and ischemic conditions, and also it's a narrow therapeutic drug, and also it's commonly available as 1 milligram, 2 milligram, and 5 milligram tablets. Yes, sir, that's all I could remember now.
What are the common side effects that we are expecting with warfarin use?
It may cause bleeding complications, and also sometimes it may cause hypersensitivity reactions like rashes, like those side effects, sir.
What is the best drug here?
It's methyl dopa tablet, 500 milligram.
What is methyl dopa?
Methyl dopa is a centrally acting antihypertensive drug.
What are the specific patient advices that you should mention when dispensing methyl dopa?
I will instruct the patient to not to exceed the recommended dose and take exactly as prescribed by the doctor, and do not stop taking the drug suddenly, and do not take alcohol while on this drug. Yeah, I will give the instructions like that, sir.
Okay. What is this device on the image number 1?
It's a dry powder inhaler, sir. Typically, we call it as also florhaler.
Okay, then. What is the dosage form that we use with this particular device?
Dry powder inhaler capsule, sir.
Okay. Tell me patient advices for this particular device, how to use it step by step.
Okay, sir, I'll tell. First, wash your hands well and dry them completely. Then reveal the capsule chamber by turning the mouthpiece, and then remove a DP capsule from the blister pack.
immediately before use, and place it in the capsule chamber, and then close the DP inhaler by using the mouthpiece. Now the DP inhaler is ready to use. Then cough up as much as possible, and then breathe out completely to empty your lungs, and do not breathe out into the DP inhaler. Then place the mouthpiece between your teeth and tighten it with your lips. Then tilt the head backwards a little, and then take a deep and a steady breath. So as you have start breathing, you will hear a unique sound if you are using it correctly. And then remove the mouthpiece from your mouth, and then hold the breath for about 10 seconds. And then exhale through the nose, and gargle or rinse your mouth with warm water after using, especially after using corticosteroid DP capsules. And then remove the empty DP capsule shell from the capsule chamber, and then store the DP inhaler properly. Yes, those are the instructions that I would give.
Okay, very good. Okay, then tell me, Puta, what are the legal documents that we should display in a community pharmacy as per the legal requirements?
Legal documents, no, you mean to display in the pharmacy?
Yes.
Okay. The license obtained from the National Medicines Regulatory Authority to sell therapeutic goods by retail should be displayed, and also a photograph of the responsible pharmacist, and also the pharmacist on duty must be displayed, and also the registration certificate of the responsible pharmacist should also be displayed in the pharmacy, sir.
Any other documents should display or the available in pharmacy when authorized officers come to your pharmacy for the inspection?
Yes, sir. The registration certificate of the other pharmacies on duty must be available, and also the business registration certificate also should be available.
How do you obtain the business registration for a pharmacy? As you know,
Sorry, sir. Actually, I have no idea about that.
Okay. How do you obtain the retail sale license for a pharmacy?
First, we have to apply for the location approval. Then the authority will inspect the location and then give the location approval. Then we have to apply for the NMRA to obtain the retail pharmacy license. If all the conditions are compatible and they are within the expected criteria, then the NMRA will issue the license for us. Yeah, that's all, sir.
Okay. What is the maximum validity period for a license for a retail pharmacy?
It's valid for only 1 year, sir.
After 1 year, what are you going to do?
Before 3 months from the expiry date of the license, we have to renew the license, sir.
Very good. Okay. Then tell me, what are the other legal documents that you are maintaining in your pharmacy? I mean, not to display, but you should maintain.
Yes, sir, I will tell. We have to maintain the prescription book, and also we have to maintain the dangerous drug register. And at present, we have to maintain a special drug register to enter the prescriptions, including the drugs like pregabalin, gabapentin. And also we have to maintain temperature monitoring charts. And also we have to maintain an expiry drug register. And also we have to maintain our invoices, like those things we have to maintain, sir.
Tell me about the expiry drug register or the book. How do you manage and maintain the expiry?
After drugs have been expired, we separate them from the normal dispensing area, and then we enter all the details about those expiry drugs, including their names, expiry dates, quantities, manufacturer details, and batch numbers. So by including those things, we maintain it properly. Yes, sir, that's all.
Okay, very good. පුතායි අර රෙගුලේටරි සහ ෆාමසූටික් පැත්ත සුපිරිය තියෙනවා. අර ෆාමකොලොජි චුට්ටක් සමහර තැන් තිබ්බ පොඩ්ඩක් හිරවෙන තැන් ඒවත් චුට්ටක් හදාගමු. ඕල්මෝස්ට් සවුලක් නැහැ. තව එකක් දෙයක් ප්‍රැක්ටිස් කරනකොට හොඳ ගන්නට එයි. ඒක නිසා
Okay, sir, thank you.
පොඩි පොඩි ඒවා හදාගමු.
Okay, sir.
ඊට පස්සේ 494 494 නැද්ද ළමයි 494 ළමයි ඔයාලගේ chance එක ගන්න අපරාධ නැත්තම් ආ පාරසි 94 කියලා දාලා තියෙන group එකේ නම් වැරදිද දන්නේ නැහැ. නම තියෙන්නේ මාධවි ගුණවර්ධන හරි වගේ. හරි. මම දන්නේ ඉතින් ස්ලොට් එක ලොස් වුණා තමයි. දැන් ඒ අනිත් අයගේ තියෙන අද රික්වෙස්ට් කරපෑට හෙට දාන්න දෙන්නේ නැහැ. කරන්න දෙන්නේ නැහැ ළමයි. ඔයාලා ඔපචුනිටි එක මිස් කරනවා නම් ඉතින් ඒක ඔයාලා ගතේ ඉතින්. 1391 ළමයි.
Yes, sir.
Shall we start with that?
Okay, sir. Good evening.
Good evening, Buddha. What is your name and where are you from, Buddha?
I am Rehan from Candy.
Okay. What is this product, Buddha, on inhalation number 3?
It is oral refrigeration. So it's G1.
What is the dosage for?
It is powder.
Okay. How do you describe the package of this particular product?
It is Cheshire, sir.
Sorry, Buddha. I didn't get
Cheshire.
it. Cheshire. Okay.
Cheshire.
Okay. What are the storage conditions that you would recommend before the reconstitutions and also the after the reconstitution?
Before reconstitution, it can be sterile room temperature below 30 degrees Celsius. After reconstitution also, it should be in room temperature for 24 hours or in refrigerator for 48 hours.
Okay. Then how do you advise for a patient regarding the reconstitutions process of this particular dosage form?
I will advise the patient to wash hands and check the product. Take 1000 ml of freshly boiled and cool water and add whole Cheshire into the bottle and dissolve it and dissolve it with. And use it within 24 hours if stored in room temperature.
Okay. What are the components that included in this particular product?
Sodium chloride, sodium citrate, potassium chloride, and glucose.
What is the role of anhydrous glucose in this formulation?
It facilitates sodium and water co-transport.
What is the role of sodium citrate here?
It reduces the metabolic acidosis.
Okay, brother. What is this dosage for? Under image number 3?
It is a suppository.
What is the dosage for?
Suppository.
What are the common indications for this drug?
It is a laxative. It is used for constipation.
What are the other laxative including drugs that do you know?
Lactulose. Liquid paraffin.
Any other?
Methyl cellulose.
Okay, how do you advise for a patient regarding the correct use of this particular dosage?
I will advise to wash hands and check the product. And lubricate it with water after taking it out from the strip pack. Lie down on the bed and bend the leg, knee facing chest, and gently insert the sharp end into the rectum as much as possible and wait for 5 to 10 minutes and on the same position. And after that, wash hands thoroughly with soap and water. Don't pass to for 1 hour at least.
Okay, what are the other suppositories that available in your farms?
Paracetamol suppositories. Diclofenac suppository. Domperidone.
Okay. I'm moving for a prescription. What do you think about prescription number 4, Putta, in here?
It is not a genuine prescription, sir. It is out of date. And prescriber's SMS registration is not mentioned here. And there is some drug interaction.
What are those?
The warfarin and atostan have interaction. It will cause warfarin toxicity. And
Warfarin and which drug, Putta? Warfarin and?
Atovastatin.
Are you sure?
Yes, sir.
Okay. What are the other issues with this prescription?
And there is risk of severe hypertension. And hyperkalemia risk also less.
Hypokalemia.
Hyperkalemia.
Hyper. With?
Yes. With capillary and spiral.
Are you sure?
Yes, sir.
Okay. Is there any other issue? What about the frequency and the dose of the spironolactone?
Yes, it cannot be given nocturnal. It should be given
Mhm. What happen when we use spironolactone at night?
the sleep will disturb high frequent urination.
Mhm. What is the drug group of spironolactone?
It is a diuretic, sir.
Sorry,
It is a diuretic.
diuretic. Oh,
Yes.
what is this specific category? There are several kind of diuretics. No? But this one.
Potassium sparing, right? Potassium sparing diuretics.
Mhm. What are the common side effects for spironolactone?
Hypokalemia,
Mm-hmm.
edema,
Edema.
yes,
Are you sure? What is the basic mechanism of a diuretic?
this one, that's right.
Mhm. Okay. Okay, then tell me, Buta, how do you keep notes for the temperature monitoring in your pharmacy?
Sorry, sir.
How do you keep records for temperature monitoring in your pharmacy?
We check temperature twice daily,
Mm-hmm.
in the morning and evening.
Mm-hmm.
We record it with the time and time. We record it, the time, temperature, and the recorded staff signature. So dates.
Mm-hmm. I will describe a particular scenario. You listen and reply to the condition. Okay. There is a patient came to your pharmacy that he is asking for a few tablet of GTN without prescription. He has chest pain and he don't have a prescription, but he has empty bottle of GTN with him. How do you handle these situations, and are you going to dispense for the patient or not?
Yes, in this situation, I will dispense 2 or 3 doses of GPN because the patient's condition, and I will tell him to go to the hospital immediately.
Mhm. You mean you dispense few doses?
Yes, it's a few doses, only 2 or 3 doses.
Mhm. Okay. What are the patient advices that you should provide when dispensing GTN like drug?
I will tell the patient to keep it in original package. Don't keep it on direct sunlight. Discard that open bottle after 8 weeks. And do not insert anything into the bottle like cotton wool, things. And if patient feels chest pain, I will advise him to keep one tablet under the tongue. After 5 minutes, if it is not recovered, take second dose, and within 15 minutes, maximum 3 doses can be taken, and advise him to rush to the hospital.
Okay, your time almost over. පුතාගේ තියෙන ඉෂුව එක මොකක්ද දන්නවද? පුතාගේ voice එකේ confidence level එක අඩුයි ඈ. ඔයාගේ සමහර ඒවා එනවා ඇහෙනවා හොරයි. ඒක නිසා මම හිතනවා අපහැදිලි වගේ තේරෙනවා. ඒ කියන්නේ සමහර ඒවා answers එනවා ඔයාගේ චුට්ටක් තියෙනවා හැම voice එකේ confidence level එක අඩුයි. පුතේ ඒක හදාගන්න වෙනවා. ඒක අපි ටිකක් තව practice කරලා බලමු. එතකොට improvement එකක් තියෙයි. දැන්ට තියෙන රවුල් ටික තමයි එනවා සමහර ඒවා ඇහෙනවා හොරයි ඒක නිසා පැහැදිලි නෑ වගේ තේරෙනවා. හරි. එතකොට ළමයි ඔන්න ඕල්මෝස්ට් ස්ලොට් එක ඉවරයි. අන්තිමට හිටිය පුතා ප්‍රැක්ටිස් කරා මුලින්මනේ. දෙවෙනි එක ගත්තනේ. ඉරේෂ් පුතානේ.
ඔව් සර්.
අපි ගත්තනේ. හරි. එතකොට පොලිෆාමසි ගැන අහලා තියෙනවා. මම චුට්ටක් පොලිෆාමසි මතක් කරලා යන්නම් ළමයි. ඔයාලට වැදගත් නිසා. තමයි පොලිෆාමසි ගත්තාම several kind of පොලිෆාමසි තියෙන්න පුළුවන්. අපිට දක්න හැම එකටම පොලිෆාමසි කියන්න බෑ. සාමාන්‍යයෙන් අපි පොලිෆාමසි කියන එක define කරන්නේ more than 5 or more drugs තියෙනවා නම් prescription එක අනවශ්‍ය විදිහට අපි සාමාන්‍යයෙන් කියන්නේ පොලිෆාමසි කියලා තමයි. ඒ කියන්නේ ඒක හැබැයි මෙහෙම ටිකක් සමහර chronic conditions තියෙනවා. patient-ලා manage කරන්න ගොඩක් drugs prescription එකකට add කරන්න ඕනේ. හැබැයි single patient කෙනෙකුට generally 5 or more drugs යනවා නම් අපි ඒ වගේ එකක් සාමාන්‍යයෙන් කියන්නේ polypharmacy කියලා තමයි. හැබැයි polypharmacy වල several kind of තියෙනවා. ඔයගොල්ලෝ polypharmacy එක define කරනකොට ඒ specific type එකත් එක්ක කියනවා නම් තමයි ඒකට වඩා අර්ථවත් තේරුම සහ යදාළ තේරුමෙන් සාමාන්‍ය polypharmacy වල types ගත්තාම තියෙනවා same class polypharmacy තියෙනවා. prescription එක දිහා බැලුවම ඔයා දකින්නවනම් එකම group එකේ drugs දෙකක් තියෙනවා නම් හෝ එකම system එකේ add කරන drugs දෙකක් තියෙනවා. උදාහරණයක් ගත්තාම angiotensin receptor blockers සහ angiotensin converting enzyme inhibitor same system එකේ add කරා. antihistamines දෙකක් තියෙනවා. NSAID දෙකක් තියෙනවා නම් ඒවා ඇවිල්ලා same class එකේ polypharmacy. එතකොට ඔයාලට ඒ වගේ එකක් ඒ විදිහට අඳුරගත්තොත් ඒකට කමෙන්ට් කරන්න පුළුවන්. එතකොට සාමාන්‍යයෙන් same class එකේ ඒවා use කරොත් risk එක තියෙන්නේ අපිට unknown side effect වලට ගොඩාක් risk එක වැඩි. ඊට පස්සේ multi class polypharmacy තියෙනවා. ඒක මේ වගේ සාමාන්‍යයෙන් සමහර ඒවා තියෙනවා various group හැබැයි එයාලගේ therapeutic goal එක එකයි. kind of same therapeutic effects තියෙන්නේ. එතකොට අපි ඒවා එකට prescription එක දකිනවා නම් ඒවා අපි multi class polypharmacy කියනවා. උදාහරණයක් ගත්තොත් අපි ඔය PPI එකක් එක්ක H2 receptor blockers දකිනවනේ combine කරලා famotidine ඕනි තරම් ඔයගොල්ලෝ දැකලා තියෙන එකට ලියනවා. ඒවත් kind of multi class polypharmacy තමයි. එකම focus එකට drugs දෙකක් add කරලා තියෙනවා. අපි එකකින් manage කරන්න තියෙන එකට තමයි additional තව එකක් දාලා තියෙන්නේ. ඒවත් සාමාන්‍යයෙන් ලෝකෙ consider කරන්නේ polypharmacy විදියට තමයි. ඊට පස්සේ අපිට හම්බ වෙනවා ගොඩක් වෙලාවට මේ කියන අර ඇඩිෂනල් ඇඩ්ජුවන්ට් එකක් විදිහට යන පොලිෆාර්මසි. ඒ කියන්නේ එක ඩ්‍රග් එකක් විදිහ නිසා තව එකක් ඇඩ් කරන්න සිද්ධ වෙලා තියෙනවා. උදාහරණ NSAID එකක් ලියනකොට gastric irritations එන නිසා omeprazole ලියන්න වෙනවා. අපි හිතමු තව මොකක් හරි ඩ්‍රග් එකක් එන නිසා ඒකට ඩයරියා එන නිසා අපිට මොකක් හරි තව එකක් ලියන්න වෙනවා බස්කෝපෑන් වගේ එක. එහෙම නැත්නම් අපි හිතමු තව ඩ්‍රග් එකක් එනවා ඒකට නියුසියා වොමිටින් එනවා ට්‍රැමඩෝල් එකක් ලියපුවාම ඩොම්පෙඩෝන් ලියන්න වෙනවා. එතකොට ඒවා ඇවිල්ලා kind of polypharmacy තමයි. ඊට පස්සේ augmentations of polypharmacy නම් මේකෙදි ගොඩක් වෙලාවට එක ඩ්‍රග් එකක lower dose එකක් එක්ක තව එකම group එකේ හෝ තව ඒ වගේ kind of යන drugs ලියනවා. ඔයගොල්ලෝ දැකලා තියෙනවා සමහර අය ලියනවා antihistamines දෙක ලියනවා එකක ටිකක් low dose එකක් ලියලා පිරිටන් වගේ එකක් මානි dose එකක් දාලා ආයෙ එකටම add කරනවා cetirizine වගේ එකක් nocte dose එකක් එක්ක. එතකොට එක drug එකකින් manage කරන්න පුළුවන් එක අර වගේ doses අඩු කරලා හැම ලියනවා ඒවත් kind of polypharmacy තමයි. ඒක සමහර ඒවා තියෙනවා total polypharmacy කියන්න පුළුවන්. එතකොට ගොඩක් වෙලාවට කිසිම ලොකු consideration එකක් නැතුව ගොඩක් total number of ගොඩාක් unnecessary medications දාලා තියෙනවා නම් drug එකට total polypharmacy කියන්න පුළුවන්. polypharmacy වලට comment කරද්දී පරිස්සම් වෙන්න ඕනේ මේවා අතර තියෙන්න පුළුවන් rational combinations තියෙන්නත් පුළුවන් irrational ඒවා තියෙන්නත් පුළුවන්. උදාහරණයක් ගත්තොත් antibiotic දෙකක් වුණත් අපි cotrimoxole ඇතුලේ ගත්තොත් trimethoprim සහ sulfamethoxole ගත්තාම එයා rational combination එක. එතනින් ගියාම අපි clavomoxole ගත්තාම calvanic acid එක සහ moxilin අතර තියෙන rational combination. irrational combinations තියෙනවා. එතකොට ඒවට තමයි අපි combine කරනවා. දැන් සාමාන්‍යයෙන් coamoxiclav azithromycin වගේ එකක් combine කරනක irrational. ඒ කියන්නේ ඒක අපි rational විදිහට consider කරන්නේ නැහැ. ඒ වගේ ඒවා අඳුර ගන්න කමෙන්ට් කරන්න පුළුවන් වෙන්න ඕන ළම. මම හිතනවා අයිඩියා එක polypharmacy කියන එකට එන්නේ නැති කියලා. සාමාන්‍යයෙන් ඔය වගේ අයිඩියා එකක් තමයි දෙන්න. අපි මේ කතා කරා ළමයි prescription and dispensing වලදී. මම නැත්තම් චුට්ට ආයෙ බලන්න. හරි එහෙනම් ස්ලොට් එක ඉවරයි. even ඔය මිස් වෙච්ච අයගේ still තව කාට හරි ඔය නම් chance එක දෙන්න. මම එහෙම ක්ලාස් එක කලින් ඉවර කරන්න. එහෙම මට ළමයින්ට අපහසුවක් කරන්න අවශ්‍යතාවයක් නැහැ. ඔයගොල්ලෝ මිස් කරනවා නම් ඒකට ස්ලොට් එක මිස් කරනවා නම් පනිෂ්මන්ට් එකක් තියෙන්නත් ඕන. chance එකක් දෙන්න පුළුවන් even මිස් කරපු දෙන්නෙක් ඉන්න.
Sorry, sir. I wasn't able to join, sir, at that time. Can I get the chance now, sir?
Okay. Okay. We will continue with the. Okay. Okay. Shall we start with the?
Yeah, sure, sir. Good evening, sir.
Good evening, Putha. What is your name and where are you from, Putha?
I am Akmala, sir, from Colombo.
What is your pharmacy, Putha?
My pharmacy is Osmania. It's in Panandura.
Okay. How many numbers of prescriptions are handled in your pharmacy per day?
About 30 to 35, sir.
Okay. Okay, Putha. I am the patient. Assume as I am the patient, we are going to dispense this prescription number 3 for me. How do you dispense it to me?
Okay, sir. Let me check the prescription, sir. Since you are using OCP, sir, there is another drug which is mentioned, doxycycline. So I think, sir, that both drugs are not compatible. It will affect the OCP's effect.
How do you explain it to the patient? You should explain to me what happened.
Yeah, so okay, sir. When he is using OCP, then if that patient use the antibiotic, it will reduce the effect. So he should find another type of method for the contraceptive, or should avoid broad spectrum antibiotic.
Patient don't know what is the broad spectrum, what is the narrow spectrum. You should explain it.
Yeah, exactly. So then I can say avoid using that drug, specifically the doxycycline capsule. Or I can contact the prescriber and I can substitute another drug behalf of that.
Mm-hmm.
And let me dispense with his consideration another one, sir.
Mm-hmm. Okay. What is the third drug here?
That is benzoyl peroxide cream, local application.
Mm-hmm. What are the common indications?
That is for scabies, sir.
Sure. It is not benzyl benzoate. It is benzyl
Benzoyl.
peroxide.
It is, then I can say, sir, it's dermatitis, sir. Or any type, or eczema.
What about acne?
Acne. Yes, sir.
Mm-hmm.
I think it is indicated for acne.
What do you think about fourth drug here? Isoretinoid.
Sorry, sir. I have no idea about the drug, sir.
What are the specific advices that you should provide these particular female patients when dispensing drug like a isoretinoid?
Actually, I haven't come across that drug, sir. But even though I think, sir, if I can have a patient leaflet or product leaflet regarding that product, sir, I can refer through that and I can provide my maximum advice to that patient.
Very good. So in here, this female patient is in childbearing ages. So he may be or could be pregnant anytime if she is sexually active. When we dispense in vitamin A derivatives like retinoid derivatives, they carry the capacity of teratogenic risks. So we should learn about the risk. Okay. Okay, Puta. Okay. If I came to your pharmacy to take this paracetamol syrup OTC, how do you sell this product to me?
Okay, sir. Since this drug is Schedule 1 drug, so I am confident in that dispensing that drug, sir. First of all, I have to ask the age of the child, and according to that child's weight, I can instruct the volume how much the patient should administrate. Then I can say about that the storage, how to keep that, and frequency of the drug should administer throughout the day. Then I can give another advice regarding the maximum dose should be how much.
You should advise
Not
to me. You should advise to me when selling this.
Exactly, you are the patient now, sir. You mean like that?
Yes.
Yeah. Okay, sir. Okay, sir. Sorry. Then I can say you that if you need, actually I don't know the condition for what reason you are taking the drug. So if it is a fever
So Buddha, you should ask questions from me and verify the conditions that I am having.
Okay, sir. Then this is actual this drug. This dosage form is for the children. So as a parent, if you come with, then I have to I should ask, is that for what age of child? Then what is the purpose you are using for? And weight of the child I should ask. I will ask. Then can you please let me know the weight of the child?
I would say 15 kg.
Yeah, the 15 kg. So then you have to take 1 kg 15 milligram. You should take 225 milligram. That means 5 ml. It has 120 ml. So almost nearly. Shall I do the calculation, Joseph?
Okay. What are the specifications of this particular product container type?
Yes, sir. This container type is primary container is plastic container with amber color and with a child lock resistant. It is there. Then primary, that is primary. Then secondary package is cardboard carton pack.
Okay.
And there is a measuring lid also included.
Okay. What are the extemporaneous preparations that are available in your pharmacy?
Sorry, sir. In our pharmacy, there is no any extemporaneous preparations.
If you do the extemporaneous compounding in a pharmacy, what are the requirements?
Yes, sir. I have heard about that. If we are having a with compounding area, there is a certain rules to be followed, like clean tiled area with the only for the specific use. We should have a sink and necessary apparatus like that mortar and pestle. Then accurate calibrated utensils like dispensing balance or electronic balance. Then ointments, slab and spatulas. The hygiene, the place should be hygienic.
Okay, I think
so, sir.
Okay, but I will describe a particular scenario that happened in a community pharmacy. You should comment for that, okay? There is a patient. In his prescription, there is several drugs. He say he don't have money for the whole prescription. He asked for 5 days of a fill. How do you handle the conditions? Are you going to fill for 5 days or not?
Yes, sir. I think it is, first of all, I should screen the prescription. I should thoroughly check the prescription. Is there any drug like antibiotic or not like that? If there are any antibiotic mentioned means, it is my duty to instruct the patient to fulfill that course and give priority to that drug compared to other drugs, purchasing other drugs. If it is not there, sir, I can prescribe the what are the amounts he can afford. For that amount, I can prescribe that dispense the drug, and I think it is better to put a mark or note with the master pharmacist sign. This much only have dispensed like that, sir.
Mm-hmm. Okay. Okay. When the same patient, the prescriber has prescribed a particular brand of a product, but patient say he can afford it, but prescriber mention as do not substitute at the end. How do you handle the prescription, and are you going to substitute or not?
In this case also, sir, I should consider as a pharmacist, certain types of drugs I can't substitute. I have to follow the doctor's rule uh, regarding considering of the patient health only. Certain types of drugs like CNS drugs and anti-epileptic drugs. So I have to again I wish to emphasize that again I have to go through the prescription, and I want to make sure about the drugs what have prescriber has mentioned. If it falls under that category, then I have to explain the patient. I can't go over the prescriber's command condition. So I have to follow the prescriber's rules.
What are the rules that for the generic substitutions as per the NMR regulations? What kind of things that you want to perform when these substitutions done?
Actually, sir, I didn't get it. What you mean?
I mean, Smita, what are
Yes.
the requirements that required by the NMR regulations when you doing substitutions for a particular brand?
Okay, sir. Then if I did not see any seal or any marks like do not substitute like that, then I considering about the patient affordable, I have it is my duty to explain or tell that what are the brands available, and I have to convey the price of the brands, and I can give a choice to the patient which is affordable to him, and I can dispense that, sir.
Okay.
If I am not mistaken.
Yes, you're correct. Then your time almost over. ලොකු අවුලක් නැහැ. සමහර තැන් තියෙනවා පොඩි පොඩි හිර වෙච්ච තැන්. ලොකු අවුලක් නැහැ. ඇවරේජ් තියෙනවා. තව perform කරද්දි හරියයි. හරි.
Thank you, sir.
හරි. අපි overall ඔක්කොගෙම ලකුණු දානන් ළමයි මම පොදුවේ. ඒ බලලා තමන්ගේ අඩුපාඩු තියෙන ඒවා තමන් හදාගන්න ඕන. එතකොට
Excuse me, sir. Sir, in that doxycycline OCP prescription, you were asking some questions, sir. I made a mistake, no, sir. What type of mistake I made, sir?
Yes, you didn't comment as a pharmacist profession. You just mentioned the advices with the technical terms and other stuff. No, but the patients can't understand those things. No, so you should clearly explain the reasons, and you should demonstrate the your behavior with that kind of a prescription with the patient.
Okay, sir. Okay, sir.
Okay.
Thank you.
හරි දෙන්නෙක් ඉන්නවා perform කරපු නැති දැන් perform කරනවා කියලා දාලා තියෙන පුතාගේ ඉන්ඩෙක්ස් නම්බර් එක මොකක්ද
1580 sir
හරි විනාඩියකින් නෙමෙයි 15 1580 පුතා කමෙන්ට් කරාද දවල්?
So I didn't select a slot, sir, because it was already all were taken.
If you try today for the first round, you don't have another slot, putaa. Is it okay?
It's okay, sir. I would like to try.
Okay, putaa. Tell me your index number, putaa.
1580.
1580. Okay. Then shall we start?
Okay, sir.
Okay, then. Okay, putaa. I am the patient. You are going to dispense this prescription for me. Prescription number 4. How do you dispense it?
Number 4. Verapamil, metoprolol, digoxin. Contraception block. Sorry, sir. I don't have any idea.
Okay, then tell me, are you going to dispense this? Are you going to dispense for this prescription or not?
Since no, it cannot. I mean, the patient's information, then the frequency, duration, and everything is all right. But the doctor's the SLMC number is not mentioned. Therefore, we don't know whether it is whether the doctor is really reliable or not. So there is a confusion in dispensing this prescription.
Any other deficiency in this prescription rather than the prescriber SLMC registration number?
Deficiency. No, sir. I don't see any deficiency.
This patient having second degree AV block. So in prescription there is verapamil and also the metoprolol. What do you think about that?
Metoprolol is given for cardiac failure, but
there is a major contraindications
I'm sorry, sir.
There is a major contraindications for calcium channel blockers and as well the beta blockers for the second degree AV blocks. With the people with heart block, we don't recommend the calcium channel blockers and as well the beta block. And also here, verapamil and metoclopramide can interact, can cause severe heart block. Also in here, digoxin are added, so there is increased risk. What is digoxin, Puta?
Digoxin is a cardiac glycoside, sir. It is given indicated for cardiac failures.
What are the possible side effects that we are expecting with digoxin use?
May cause digoxin toxicity.
Only digoxin toxicity. No any other side effect.
That's all I could remember at present, sir.
Mhm. Okay. Tell me, what are the patient advice that you are going to give when dispensing digoxin?
Patient advice. It's advisable for the patient to take at the recommended time, since it may cause fluctuations in the blood plasma concentration fluctuation of the drug in the blood plasma. It's advisable to take at the same time, and mm, mm, mm,
Mhm. Okay, but what are the common indications for beta blockers?
beta blockers.
Yes.
Beta blockers are indicated for hypertension, angina, angina, and some are given for migraine as well.
Mhm. Okay, tell me a few examples for beta blockers that do you know?
Beta blockers. Um, Beta blockers. Bisoprolol, carvedilol, metoprolol, then propranolol are some of the examples.
Okay, what are the common indications for calcium channel blockers?
Calcium channel blockers, cardiac arrhythmia, hypertension, mm, mm, calcium channel blockers. Mm, that's all I could recall by now, sir.
Okay, Buddha. I am the patient. You are going to dispense this mouthwash for me. What are the advices you should provide for me, and how do you dispense this for me?
Mouthwash.
Yes.
Uh, um, um, we have to ask the patients to rinse the mouth 2 or 3 times per day, and after rinsing the mouth, not to eat or drink or anything till the medicaments come in contact with the surface of the oral cavity. And once after rinsing, also always ensure to keep it tightly closed. That's it, sir.
Mhm. Okay. Then I will describe the particular scenario. Tell me, how do you respond for this scenario? A patient came to your pharmacy. The prescription is for a laxative. You notice that that patient usually come to your pharmacy with various prescribers prescription, but always he the same drug for the laxative purposes. So how do you handle the conditions, and do you advise the patient regarding the condition?
It means the same laxative is being asked several times.
Yes, from different prescribers.
From different prescribers.
Yes.
First of all, sir, as a responsible pharmacist, I should inquire the problem he is having. Is he really suffering from any constipative diseases or anything? And I should tell him that the same drug is being requested many times. So uh, frequent dispensing cannot be dispensed like that. Uh, on patients, I mean, if he on patients' willingness, if he allowed, if we can request him, I could request him to contact the prescriber and ask the real cause for it. Mm, uh, so mm, that's how I think I should deal with the situation.
Okay, Buddha. Time almost over. We'll see. ගොඩක් කලාවට කමෙන්ට්ස් වල ගැටලුවක් නැහැ පුතේ. තියෙනවා සමහර අන්තිය දැන් තියෙනවා සහ ආන්සර් දෙන්න නැතුව දැන් තියෙනවා සහ ක්ලියර් කියව තියෙනවා. ඒව චුට්ටක් කියවන්න ඕන. අනිත් එක හැමෝටම පොදුවේ කියන්නේ අර දැන් අපි ඔයාලට එක්සැමිනර් පේෂන්ට්ගේ සයිඩ් එකේ ඉඳලා ඒක ඩිස්පෙන්ස් කරන්න හෝ ප්‍රෙස්ක්‍රිප්ෂන් එක හෝ ප්‍රොඩක්ට් එක කියනවනම් එක්සැමිනර්ස්ගෙන් පේෂන්ට් කෙනෙක්ගෙන් වගේ ක්වෙස්චන් සහ ඒක අර ඇක්චුවල් සිනාරියෝ එකක් විදිහට කරන්න තමයි. ඒක තමයි එක්ස්පෙක්ට් කරන්නේ. එතකොට නැතුව නිකම්ම අර පේෂන්ට් ඇඩ්වයිසර්ස් හෝ ඒ ටික කියන්න එපා. නිකන් අර අපි ටිපිකලි කියනවා වගේ. ඒක හරි විදිහට අපි කළා බලමු ඉස්සරහට. ඒකත් පුරුදු වෙන්න දැන් කාලයක් පැන්න ගියා අහනවනම්. හරි. එහෙනම් අපි හම්බෙමු ළමයි. available slot එක හෙට ටික උදේ දානවා. කැමති අය සිලෙක්ට් කරලා perform කරන්න. අද perform කරපයට හෙට chance එක නැහැ. එතකොට ආයේ මේ round එක ඉවරුනහම තමයි ඔයාලට next chance එක එන්නේ. හැටම perform කරවන්න එපා ළමයි. බලෙන් හරි කරවන්න එපා. ඉතින් එන්නෙත් නැහැ සමහර අය මග හරිනවා. මම දන්නේ ස්ලොට් එක ඕගොල්ලෝ ලොස් කරගත්තොත් ලොස් තමා. එක්සෑම් එකට ගිහිල්ලත් ඒකම තමයි වෙන්නේ. මට කරන්න පුළුවන් උඩරේම දාගත්ත දෙනවා. ඒකේ ප්‍රයෝජනය ගන්න එක ඔයාලගේ අතේ තියෙන්නේ. මම ලිමිටඩ් නම්බර්ස් අරන් කරන්නේත් ඒකයි. අහලා එළිය ඉන්නවා 10ක් 12ක් විතර ඉන්නවා. ගත්තේ නැත්තේ කරන්න බැරි නිසා ඔයාලා ප්‍රැක්ටිස් කරවන්න ඕන නිසා ඉතින් ඒකක් එහෙම ලිමිට් කරලා තියාගෙන ඉද්දිත් ඔයගොල්ලෝ ඒකේ ප්‍රයෝජනය ගන්න නැත්නම් ඉතින් මට කරන්න දෙයක් නැහැ ළමයි. මං කියන්නේ VIVA just practice ඔස්පියලාත් ඕක කිව්වා. ලියලා ටයිමින් හදාගන්න questions pattern හදාගෙන ඒක critically ඒවා think කරන්න හදාගන්න කියලා. කරගත්ත අය ගොඩයයි. ඉතින් අනිත් ඒවාට කරන්න දෙයක් නැහැ. හරි. මේවා රෙකෝඩින් සහ ඒ ටික මම drive එක අප්ලෝඩ් කරන් යනවා ෆෝල්ඩර්ස් හදාගෙන ළමයි. තාම මම අර payment instructions එහෙම දාපු නිසා drive එකට කවදාවත් add කරේ නැහැ. ඒ ටික දාලා drive එකට add කරන්න. එතකොට ඔයගොල්ලන්ට ඕන වෙලාවක access කරන්න පුළුවන්. recordings ඔක්කොම previous years වල ඒවත් එක්කම දානවා. ඒවත් ඔයනම් බලන්න පුළුවන්. හරි. එහෙනම් අපි හෙට හම්බ වෙනවා. හැමෝටම good night. ප්‍රශ්න ගැටලු තියෙනවා නම් අහන්න. චූටි වෙලාවක් ඉන්න.
Excuse me, sir.
පුතේ.
Sir, there is a difference between OCP and ECP, no, sir. Oral contraceptive pills and emergency contraceptive pills.
Yes, usually when we considering emergency, there is a high dose always. When we are considering the usual oral contraceptive, there is a low dose, and we are used as prophylaxis. No, when we are emergency one, there is always high dose.
Then, sir, one student was you gave the prescription for that, no, sir, regarding that issue dispensing that one. So at that time you were questioning about the emergency contraceptive, no, sir, you were asking.
Yes.
At that time, sir, it is more suitable, sir. Postino 1, Postino 2, and Mithuri, we can say, no, sir. Other than that, other also can be say, sir.
No, Pata.
Yasmin and all.
In that case, there was a 16 years old girl, no?
Yeah.
So we can't even emergency contraceptive pills don't need a prescription to dispense. Even that we can't dispense for a minor one. So 16 years, no? So we should consider both legal.
We can consider about like that menstrual order problem, like we can consider like that, no, sir?
Yeah, no, we should consider both ethical and also the legal requirements. Both, we should balance both with that. If we don't dispense, she could be pregnant. That is unnecessary problem, no? If we dispense, she could misuse that. Maybe her parents don't know about the conditions. Maybe she's being abused by someone. Could be, no? So our responsibility is dispense it and report for the authorities for the per the evaluations, or at least if we know parents of particular girl, we should inform about the conditions for the parents because she is 16 years old. But ethically, we can't expose the patient detail even for a family member. But in case of a minor one, we can say the details for the parents. So that's how that condition was in that particular scenario. But when we are dispensing for a normal one, it is okay.
Okay, sir. Okay, sir. Okay.
හරි වෙන මොනවද ගැටලු තියෙනවද නම? ඊමේල් ටික රික්වෙස්ට් කරලා දාන්න ළමයි ඩීටේල් එක. මම තාම ඩ්‍රයිව් එකට ඇඩ් කරේ නැති නිසා දැම්මේ එක රෙකෝඩින් එක මම YouTube එකට දාලා දැම්මන ගෲප් එකට. ඒක නිසා දැම්මේ නැත්නම් මේක දාන්න කලින් ඩීටේල් ටික දාලා ඔයාලා ඩ්‍රයිව් ලයිසන්ස් ගන්න විදිය දාන්නම්. හරි එහෙනම් අපි හෙට හම්බෙමු. ඔයාලට good night. ස්ලොට් එක පර්ෆෝම් කරන්න ළමයි. දැන් අදත් එක්කනවා එක්කෙනෙක් හරි දෙන්නෙක් හරි පර්ෆෝම් කරගෙන නැති. මන් දන්නේ මිස් කරොත් ඔයාලට තමයි ඒකේ පාඩුව. මම ෂෙඩියුල් කරලා තියෙන එක කරනවා. දැන් ගෲප් මේව කරන්නේ නැහැ. පැය 5ක් ක්ලාස් එකේ. 5ක් විතර. එතකොට ඒකේ ප්‍රයෝජන ගන්න.
සර් එහෙම පාටිසිපේට් කරන්න නැතුව ස්ලොට්ස් තියෙනවා නම් පාටිසිපේට් කරන්න පුළුවන්ද සර්?
ඔව් එහෙම වුණොත් chance එකක් දෙන්නම්. ගැල්ලුවන්නේ. හරි එහෙනම් අපි හෙට හම්බ වෙනවා.
සර්
ඔව්. එහෙම වුණොත් කවුරුත් චූස් කරන්නේ නැත්නම් ස්ලොට් අද පර්ෆෝම් කරපු අයට උනත් chance එක දෙන්නම්. ගැල්ලුවක් නැහැ ඒක. කවුරු ගන්න නැත්නම් කවුරු පර්ෆෝම් කරන්නේ අපි බලමු. හරි එහෙනම් අපි හෙට